Good afternoon. The Senate Finance Committee is now in session, and we will begin with Senate Bill 834. So I'll ask the sponsor to come forward. I'm going to call up your initial panel: Brian Wheeler, Brian Penick, and Sean Cavanaugh. Senator, as you know, you have the time that you need to lay out the parameters of the bill, and all other witnesses will have 2 minutes each. Okay.
Thank you, Madam Chair. Good afternoon, Chair Kelly, Vice Chair Feldman, and members of the committee. Thank you for hearing Senate Bill 834. Long title: Health Insurance, Two-Sided Incentive Arrangements and Capitated Payments Authorization. So in this country, we're used to a healthcare system that takes care of people when they're sick, but that doesn't make sense. People deserve access to affordable care that works and keeps them from getting sick in the first place. That's exactly what value-based healthcare is about. Value-based care adopts a proactive, team-oriented, and data-driven approach that shifts the focus to improving population health. As a result, providers are empowered to connect with their patients early and often so they can stay healthy. The best part is we know this approach is working. Data from traditional Medicare, Medicare Advantage, and Medicaid and commercial markets show that the full spectrum of value-based arrangements lead to an increase in preventative screenings, improve patient satisfaction, reduce hospital admissions, promote health equity, and lower cost. Patients who see providers who are paid through value-based contracts have better outcomes and receive higher quality care and a variety of services that help to improve their health. In value-based arrangements, care is not about volume of services provided. Health outcomes are improved because value-based contracts incentivize providers and hold them accountable for the caliber of care they receive. The framework inherently encourages providers to address health equity, social determinants of health, and improve the patient experience. When providers are engaged in value-based health care partnerships, the levels of success and reimbursement depend on whether patients are getting healthier, not just that they received a medical service. Value-based payment contracts are active in the traditional Medicare, Medicare Advantage, Medicaid, and commercial markets and are steadily growing year over year. In fact, many of our nation's largest insurers have well over 50% of their member population treated by providers in value-based arrangements. Moreover, less than 40% of all payments to providers from Medicare, Medicare Advantage, Medicaid, and commercial insurers still flow through a traditional fee-for-service model, has no link to quality, outcomes, or value. These arrangements are not new in Maryland. Both Maryland Primary Care Program and Maryland's Total Cost of Care are models of value-based arrangements.
Excuse me, I'm going to ask you to move that mic down a little closer to your mouth. Thanks.
I thought I was pretty loud, Madam Chair. We have an obligation to create a pathway for all Marylanders to also enjoy these benefits. Unfortunately, certain types of value-based arrangements are not permitted in Maryland. This restriction is unique to Maryland, and the other 49 states and District of Columbia permit value-based contracts in all markets. Senate Bill 834 opens the door for providers and insurers to voluntarily engage in optional value-based partnerships that we know promote a framework for health centered around patients, prevention, and improving health outcomes. This bill was developed through 9 months of collaboration among insurers, hospitals, and healthcare providers. It ensures participation in value-based arrangements must be voluntary and that providers are protected should they choose not to participate. It contains numerous additional patient and provider protections that are unparalleled in federal programs or in law or private contracts in other states. So some of the things included are a requirement that a bonus or two-sided incentive arrangement must promote health equity, a requirement that these arrangements must be voluntary, an opportunity for an audit by an independent third party and dispute resolution process, protects providers by setting a maximum downside risk, and ensures transparency. The metrics-driven nature of value-based care gives insurers and healthcare providers the opportunity to work together. Our communities deserve a healthcare system that recognizes health is more than absence of disease or injury. Senate Bill 834 will allow Maryland to join the rest of the country in increasing quality of care, advancing health equity, and improving patient experience while also reducing cost and creating a more sustainable healthcare system. The advocates for this bill have worked for the past 9 months with all the stakeholders, and I'm pleased to say they've come to agreement. I believe you'll hear that all witnesses are now favorable. You will hear more details about value-based health care from my panel. But just a note, Health and Government passed this out of their subcommittee yesterday with just 3 amendments. I respectfully request a favorable report on Senate Bill 834.
Thank you. Are there any questions of the sponsor? Okay, then let's move to the members of the panel. State your name, and you have the 2 minutes each.
Thank you. Good afternoon, Madam Chair and distinguished members of this committee. My name is Brian Wheeler, and I serve as the Vice President of Provider Collaboration and Network Transformation at CareFirst Blue Cross Blue Shield. I join you today to testify in favor of Senate Bill 834 to expand the range of voluntary contracting options for healthcare practitioners and payers so that together we can create greater value and achieve better outcomes for consumers. This is one of the most consequential consumer-oriented pieces of healthcare legislation to ever come before this body. Why is this bill so important? Because what we have been doing isn't driving enough impact, and what we need to do, as Senator Vidal noted, isn't possible under existing Maryland law. Consumers, employers, and governments that pay for health care are not getting value commensurate with their investment. Quality of care could be improved, especially for vulnerable populations, and many patients report that their experience with the healthcare delivery system needs some work. Many of our communities suffer from long-standing health inequities brought into sharper focus over the last few years, and some of our neighbors experience unacceptably poor health outcomes. Consumers deserve more value, and healthcare practitioners aren't rewarded for the great results that they produce often enough. We must do better. As the leader of the contracting organization for CareFirst, I seek to partner with the best performing healthcare practitioners possible so that our members can seek the care they need in our network. The principal contracting tool I have at my disposal today is fee-for-service. Perform a service and get paid a contracted amount. People engaged in an array of businesses know a fundamental truth. The economic model drives the business model. If the revenue increases when more units are generated, more units will surely be generated. Any practitioner or health system's ability to transform their operations is hampered by the fee-for-service payment system. Generating revenue in fee-for-service is entirely linked to volume and not to value, and this dependence on volume for revenue limits innovation. This legislation opens up the field of possibilities for willing payers and practitioners to innovate. These new contracting models, which CMS calls advanced payment models, create an economic environment where the best possible care is delivered more consistently over time, creating the highest value, best consumer experience, and best outcomes. Many of our partners are ready to move into new advanced payment models now, so I would be grateful for a favorable report from this committee, and I thank you very much for your consideration.
Thank you. Are there questions? Senator Feldman?
Yeah, Mr. Wheeler, just real quick, maybe, playing the role of the lone lawyer here on the committee.
Certainly.
But I would love to, because there's nothing in the testimony that, like a sample of what these contracts look like. I mean, as you point out, this is one of the bigger issues we'll be dealing with, and it would be nice. Could you just maybe, I don't want to say Cliff Notes version, but like, I'm not quite sure I understand exactly how the contracts work. I mean, could you give a little?
I'd be happy to, Senator Feldman. Thank you very much. If we think of a healthcare delivery organization, each has an established pattern of performance in 3 key areas: the quality of care that they're producing, the cost of care that they're producing, and the consumer experience. And these 3 metrics form the starting point for a value-based contract. What is your performance today, and what is a target that we might be able to mutually agree is a good target, and then what's the reward associated with that target? So we would come up with what the targets are in those 3 areas in the best interest of patient care. And then we run the year out and we see where we landed. How did we do on the quality target? How do we do on the cost target? And then how do we do on the consumer experience target? The sequencing is really important here. You want to start with quality because you never want to create a situation where the medically necessary or medically appropriate care is disincented. So we want to make sure that quality is number 1. If quality and consumer experience targets are met, then we look at cost. And then if we've had a good outcome, we share in the reward. And if we haven't had the outcome we were looking for, we share in the risk. And that's basically the way these performance-based type contracts work. Of course.
Are there other questions? Senator Augustine?
Thank you. Can you help me understand the difference between this and an HMO?
Sure, Senator Augustine. Thank you for the question. An HMO really, I think initially, when HMOs and back to when the HMO federal law first passed, were thought of as managed care organizations. And that meant often different payment models. I think that was really at the beginning. And the industry has gone in that direction and then gone away from that direction in the past 20 years or so. Today, our HMO products are typically a different network. Typically, it's a smaller network, and there typically are particular places you go for labs and x-rays and things of that nature. But this is a little bit different than an HMO product. This is a different type of contracting with providers that's more performance-based contracting. It can be on an HMO network or a PPO network. We use them for our Medicaid populations and our Medicare populations. So it's a slightly different thing than the traditional HMO PPO. What we're really talking about here is new tools in the toolbox for payers and providers to contract on a performance basis.
My confusion is you're saying slightly different, but you're not telling me what slightly different is versus sort of like the existing programs that are there in the HMO model. And I'll stop, but we can talk about it outside of this, but I'll just be very honest, like I don't see the difference. I don't understand.
Can I add something?
Absolutely.
Thank you. Senator Augustine, when there's going to be some other folks come up that talk about how this has helped their practices, but one of the things is that the funds that are given to the practice can be used for other things. So it could be for nutrition, or it could be for transportation, or other things that help the quality of care as well as helping with equity. So you'll hear from some of the providers, I think, some of the differences that I think you're looking for.
Thank you.
And with your permission, Senator, if I could.
Brian?
Okay.
I think one of the things that's similar, and what you may be thinking about, is when HMOs were first established, and HMO is a product that a person, an individual purchases, but when they were first established, the concept of capitation was introduced, right? And I think that's, Senator, where your question's coming from, is how is this similar or dissimilar in terms of capitation? And I think there's a few things that are really important to understand in terms of where we've come to in this day and age versus where we started in the late 70s, early 80s relative to managing capitation. The payment mechanism itself creates more freedom for a practitioner to exercise their judgment within quality controls, within a set of parameters in terms of what good medicine is to practice on behalf of a patient. What didn't exist in the late 70s and early 80s is the connection that we now have and the ability to help manage that process in closer collaboration with those practitioners to address patient needs through time and circumstance using data. And so in the capitation days, the early capitation days of HMO, there was an insufficient amount of information for those practitioners that were assuming the responsibility to manage patient care through time and circumstance to do that as effectively as we wanted and needed them to do. The payment structure itself wasn't flawed. The support of the payment structure needed to be addressed. One of the things that this bill does, and it's the most comprehensive set of protections that exist in any payment mechanism, in any model, whether it be federally or state-based in the country, serves to address those boundaries and those guardrails that create expectations about the kinds of information that we produce, how often we produce it, and the controls that we put in place to ensure that that information is used effectively for patient care, but also in the management of the risk for that practitioner that has that responsibility. That's the biggest difference between what you saw in the early days of capitation for HMO and what you're going to produce coming out of this bill. Does that help, Senator?
Yes. Thank you.
Okay, so if you'll state your name and who you're with, we'll have your constructive remarks.
Thank you, Madam Chair. Madam Chair and members of the committee, my name is Brian Penick, and I'm the President and CEO of Care First Blue Cross Blue Shield, and I join you today in support of Senate Bill 834. Our healthcare system does many things well, but better is possible and necessary for the people of this state. But we will need more tools to get there. Value-based care represents a new tool for our state and an opportunity to take a step forward together as we work to improve the state of health for the people of Maryland. Value-based care is a simple concept. It rewards healthcare practitioners for improving health outcomes for their patients while helping to make healthcare more affordable. It helps to enable healthcare practitioners as they work to deliver care in the most convenient and effective way for their patients, better addressing health disparities, and better aligning care with patient needs and outcomes. This is not a new concept. Value-based care is a national movement embraced by the federal government and Medicare, state governments and Medicaid, hospital systems, healthcare practitioners, and commercial payers with models in every state across our country. And it's working. It's working to support quality outcomes, to manage costs, and to make care more affordable and accessible. This bill is the product of nearly a year of unprecedented collaboration with key stakeholders, including MHA, MedChi, health systems, and independent practices. It reflects our shared perspectives, establishing unparalleled protections for healthcare practitioners while enabling innovative partnerships that advance health equity, improve patient outcomes, and reorient care towards population health. It also enables us to partner in ways that further the goals of Maryland's total cost of care program, creating better alignment across payment models. We recognize that every healthcare practitioner is unique. That's why this bill ensures that participation in these programs is completely voluntary. It is also essential that we recognize that many healthcare practitioners are ready now and willing to engage in value-based care to help create healthcare solutions that Marylanders deserve and demand. We have world-class healthcare in Maryland. We need world-renowned value-based care partnerships as well. We thank you for your time and consideration today.
Okay, now, in addition to my Medicare, which I don't do anything with, I keep my Care First policy. And tell me why I should.
Well, I would say in this context, Madam Chair, this doesn't necessarily change the way you would think about your products, right? So as a consumer, as an individual consumer, as a patient, you would still make product selections, whether they be Medicaid product selections or Medicare product selections or commercial market product selections. What this does do is it allows for us to establish a better and more consistent approach to how we universally think about value in healthcare. One of the challenges we have in this country is that we're fragmenting the time and attention of practitioners and patients with many different types of programs, many different definitions of success. What this allows us to do is it allows us to better connect that value chain so that as practitioners and patients think about what high-quality healthcare is, that high-quality healthcare definition can be delivered more consistently regardless of what product you select. And there really shouldn't be a different definition for what represents high-quality healthcare in Medicaid or for a large national employer. There should be consistency around the practice of good medicine, and when practitioners deliver good medicine to patients and good outcomes to patients, they should get reimbursed for it.
Okay. All right, Senator Hershey.
Thank you, Madam Chair. I'm sorry if I might have missed this, but with respect to the practitioners and physicians, they had some concerns that were in the testimony from MedChi, dealing with, again, what is completely voluntary, or could they possibly be pressured into participating in this, some of the protections and fee schedules. Has there been communication with them, and have you agreed to their concerns?
Senator Hershey, they did come to agreement, and they did it with Health and Government because they've already had their hearing.
Okay.
And there is an amendment, and you'll hear from MedChi in a little bit.
Okay, but so assume that their amendment has, what they're providing has been accepted by everybody?
That's what they told me on the phone.
Perfect. Thank you very much.
Okay, so we'll move on to Sean Cavanaugh.
Thank you. I'm Sean Cavanaugh. I'm the Chief Commercial and Policy Officer at a company called Aledade. Aladede's a new company. We started in 2014. We're based in Bethesda, Maryland. And we have one purpose. We support independent primary care practices as they move toward a better form of care, the value-based care you're hearing about. Prior to coming to Aledade, I worked in the federal government at the Centers for Medicare and Medicaid Services. I did the rulemaking for the Medicare Shared Savings Program, which is the ACO program, which is the largest value-based care program in the country. Prior to that, at CMS, I worked at the Innovation Center, where I helped negotiate the Maryland waiver. In a previous life, I worked at the HSCRC, where I helped administer the Maryland waiver. I'm very familiar with how Maryland works, and a proud Marylander myself. At Aledade, we do the work we do, not just here in Maryland, where we have 14 primary care practices, and we're still relatively new in Maryland, but we work in 38 states. We cover 1.8 million lives, and we are doing value-based contracts for all of those lives, whether they're in traditional Medicare, Medicare Advantage. We work with more than a dozen Blue Cross plans on commercially insured lives. for Medicaid managed care as well. And in all of these contracts, we're either in two-sided risk or we are progressing toward two-sided risk. So I just wanted to share 3 quick messages with the committee. One is, this is being done in other states. You don't need to worry that Maryland's going to be an outlier in some regard. In fact, you're the outlier now in not allowing it. It's totally consistent with the Maryland total cost of care model. In fact, it's a nice complement to it, because this is the way to engage those independent primary care docs that we work with who currently look at the Maryland total cost of care model and don't understand how they fit into it. The second message I want to deliver is this is good for doctors. So the doctors who work with us are independent primary care doctors around the country. And in fee-for-service, they're getting the worst contract. They have the least leverage to negotiate contracts. And the big insurance companies treat them like the small fries that they are. But when you move to value-based care, all of a sudden, they're more important to the plan. They are the vehicle in which the plan can get better care at lower cost. Practices that work with Aledade tend to get about 30% more revenue through shared savings in their Medicare contracts. We want to replicate that across all their lives, not just their Medicare lives. The last message I would deliver to you is it's really good for patients. So under the Aledade model, what we do is we provide patients a lot more primary care. So we did a study in 5 of our early markets, how they fared over the first 5 years. We compared patients in Aledade practices, and we matched them to patients in similar practices in 5 states where we were operating for that long. Our practices provided 35% more primary care, meaning more outreach, more wellness visits, more prevention. That led to 17% fewer hospitalizations, fewer ED visits. So bottom line, patients get more of the good stuff and less bad stuff happens to them. So good for patients, good for practices, and good for society. So thank you for your time.
Thank you. Senator Feldman, and then Bill.
Yes, Mr. Cavanaugh, well, thank you traveling all the way from Bethesda, Montgomery County. Appreciate that. So just on your last point, I mean, obviously you mentioned 38 states that you operate. I think the testimony was there's 40 some odd states that have some variation of this. So talk to me just a little bit. You know, one of the challenges we've had in Maryland has been retention or recruitment particularly in the rural parts of our state. So I'm trying to get a sense of, does this work everywhere? In other words, you know, you say it's good for the health practitioners in particular, that they would be incentivized to have practices in maybe places that may not be as lucrative as other places. Could you just speak, and also, is there some data, academic or otherwise, that discusses this topic? This is obviously new for this committee, but clearly it's been around elsewhere in the nation for quite some time. Has there been any academic sort of papers just discussing this that, you know, we could look at so we get comfortable before we become state 50 here?
Certainly. So on your first question, how does it help rural and underserved areas? We work with 1,000 practices around the country. 65% of the practices we work with are in federally designated health professional shortage areas or medically underserved areas. So we do believe we are making it viable for those practices to remain in those communities. And as I said, think of a small practice in a rural part of the state. And I don't mean to single out any insurer, but I guarantee you that practice, if they're a solo practitioner or a small practice, they have the lowest fee schedule of anybody in the network for any major insurer. It's hard to keep your business going, and these are small businesses in that environment. But when they shift to value, they have an opportunity to generate value for the payer, to be partnered with the payer, and generate additional income. Our practices are remaining viable. We've seen less than 1% of the practices we work with. The worst fate for these practices is to sell themselves to the local hospital, right? They just give up. Less than 1% of our practices do that over a 5-year period. As far as academic studies, the one area where there has been a fair amount of academic study is in the Medicare program, because the data set is big enough and it's publicly available. And there's some researchers both from Harvard and then MedPAC, which advises Congress, and I'd be happy to get you copies of those studies that show the positive outcomes.
Okay, thank you, Madam Chair.
Get it, let me have it. Senator Klossmeyer.
Yeah, thank you, Sean. It's good to see you after all these years.
Thank you,
It's
Senator.
been a long time.
It has been.
But I see that you have the two-sided program, and it's doing very well to bring in primary care patients,
That's correct.
okay? can you talk about their outcomes? Because I'm like, I need examples of that.
Sure. Well, as I mentioned, in Medicare, we participate both in the traditional Medicare program and the Medicare Advantage. All of our Medicare Advantage contracts, we bring people up from 2- and 3-star plans up to 4- and 4.5-star plans. So that's a measure of better quality care going to the patient. I mentioned we're reducing hospitalizations and ED visits in our other contracts. And that happens because our practices now are looking at lists of their patients, and they're saying, who's not coming into the practice today who should be here? So rather than just treating patients as they walk in the door, they're looking at data and saying, this person needs a wellness visit, and I'm going to call and bring that person in. This person just got discharged from the hospital. We know if a primary care doctor intervenes shortly after discharge from hospital, we can greatly reduce readmissions. So in all these measures, we're seeing improved outcomes for patients.
Okay. Now, I just have one other question. Senator Bottle said there's 2 organizations in the state. Did I hear that right?
I guess what we're referring to is because of Medicare Advantage is very similar.
Okay.
It's, it's not, the law, Maryland now doesn't allow the two-way agreement, the capitation, but Medicare Advantage is I think what Mr. Cavanaugh was
Okay.
just explaining.
Okay.
So
Okay,
it's
that's okay. I
whole
got it.
care.
Okay, I misunderstood, so.
Thank you.
All
Thank
right,
you.
thank you.
Thank you.
Okay. Senator Augustine.
Yeah, thank you. What, in the practices, what percentage of the business is in this form? And I'm thinking about risk also associated with sort of there being on both sides for everybody of this, where we're not really spreading this out as much, particularly if there's like a heavy reliance on one particular relationship. Can you just talk to me about that? Can you help me with that a little?
Certainly. It varies. Again, we have 1,000 practices. They're all at different points along the journey toward value. When we first start with a practice, we're usually just working with their Medicare lives. So in that practice, maybe 25% of their patients are in these value-based agreements.
Okay.
But there are states, Delaware is a state where Alade's been for probably the longest, and our practices in Delaware are approaching 90% of their patients in value-based deals. So we've layered on Highmark, Medicare, Medicare Advantage, some Medicaid contracts. And our doctors in Delaware, who are now very accomplished at this form of care, love it. They're getting more opportunities to make more money. They're providing better care, not just to their Medicare patients, but to their commercially insured as well.
Okay. And there's not new money in this, right? I mean, there's no such thing as like new money. So can you help me with that part too? You know what I mean?
Yeah.
There's not new money.
No, I appreciate the question, Senator. I would say, if you think about the economics of healthcare in the United States, it's not just the amount of money we spend relative to the state of health in this nation, right? It's how we spend the money. So it's the way the dollars are distributed. And so it is potentially new money in new places, right? It's an opportunity for us to say, we're looking at this holistically. We're looking at patient care holistically through time and circumstance. And if there's an opportunity to create an intervention for that patient and their state of health, in addressing not just clinical solutions, but potentially environmental solutions beyond clinical solutions, to create a better state of health, a better trajectory of health over time, would we be willing to make that investment? And in this model, it allows for you to do that. So for practitioners that have those opportunities for interventions, for practitioners that are making those choices in support of individual patient care and the management of population health, it gives them the ability to do that and us the ability to fund their actions and activities in a way that fee-for-service does not allow for.
Okay. Thank you.
Okay, thanks a lot to the sponsor and to this panel. We'll move on to the next group of witnesses. Cameron Matthews, Andrew O, Matthew Talentano, and Allison Taylor. You have 2 minutes each. The mics are movable. Okay.
All Right. Good afternoon, Madam Chair and the members of the committee. My name is Dr. Cameron Matthews. I live next door in Washington, D.C., and I'm the Chief Health Officer for City Block Health, a value-based provider for historically marginalized and underserved populations. I'm here in support of Senate Bill 834 to expand the scope of value-based care arrangements in Maryland. As a primary care physician, I firmly believe that health is more than just medicine. At City Block, we meet our members where they are. This goes beyond geography. It's a commitment to serving the whole person. We do this by taking a multifaceted approach that integrates medical care, behavioral health, and social services under one value-based care model to deliver positive outcomes at lower costs. Even more, we aim to understand and address any social determinants of health that impede a member's ability to live a healthy life. Take, for example, a 64-year-old patient with multiple chronic conditions who was recently exposed to COVID. We were able to treat him in a timely and safe manner via video consult, and our mobile care team was able to connect him with grocery deliveries and supplies for COVID symptom monitoring during his quarantine. This would be a difficult concept to support and even incentivize under current healthcare models that are fee-for-service. We are only able to deliver on this patient-centric promise in a capitated model, which allows us the flexibility to intervene and invest in dynamic ways that actually meet our members' complex needs while driving sustainable value. Since launching in 2017, we've seen great success in our care model in the communities we serve across Connecticut, Massachusetts, North Carolina, New York, and next door in Washington, D.C., in partnership with Care First. For example, data from our earliest member cohort showed a 15% reduction in emergency room visits and 20% reduction in inpatient hospital admissions. To drive meaningful value and outcomes, we need to build different operating structures and payment models. This legislation would present an opportunity for providers like us and plans like Care First to serve high-need, high-cost members in Maryland. I urge you to vote in favor of Bill 834. Thank you for your time.
Thank you. All right. Explain that.
Hi, thank you for allowing me to speak today. My name is Andrew O. I have been a practicing OBGYN in Hagerstown, Maryland since 1999. I've been a past president of the Washington County Medical Society, and for the last 5 years, I have served as the medical director for Capital Women's Care. Capital Women's Care is the largest OBGYN practice in the Mid-Atlantic. Most of our offices are in Maryland. We serve many counties, including Anne Arundel, Baltimore, Carroll, Frederick, Hartford, Howard, Prince George's, Montgomery, Washington, and Wycomico counties. We have over 200 leading providers, and so we play a very important role in maintaining the well-being of Maryland patients. In the United States today, we have a major problem. Compared to other major industrialized countries, we spend more on healthcare than anybody, but we have the highest maternal morbidity and mortality rates. If you look at other states and how they're tackling it, one of the ways is that physicians are engaging with payers in a value-based care arrangement to find ways to improve things. And, you know, in Maryland, we're not able to fully participate in this process because of the current laws. When done correctly, value-based care aligns the interests of the patient and the doctor and the payers. So we're all pulling in the same direction. And basically, when you see this at work, physicians and payers are incentivized to find ways to improve outcomes and lower complications. We're incentivized to emphasize prevention of disease rather than just treatment of disease. We are able to address in creative ways to reduce or even eliminate the disparities along racial and socioeconomic lines. And we're actually incentivized to eliminate unnecessary testing and find cheaper alternatives to the current therapies that do not compromise quality. So basically, value-based care really it looks promising as a way that we can really transform U.S. healthcare in a positive way. And as a physician in Maryland, I want to be able to participate in that. And that's why I'm strongly in favor of this bill. I do believe that if we do this, we are going to find ways to improve care for women in Maryland.
All right, Senator Klossmeyer.
Dr. O, I asked Sean Cavanaugh from his perspective, as a physician, can you describe some of the outcomes and how you got there and what you do to get your patients into the office?
Sure. Well, what I would say is, because we haven't really fully been able to do it, I can give you a real-life example where I think where the laws have hurt us. Our practice in Hagerstown, we do most of the deliveries in Washington County. We have a terrible obesity problem there. So we know how to take care of obese patients. We know how to manage gestational diabetes and all the complications that come from that. But several years ago, we decided to hire nutritionists because we wanted to do something that would actually help lower the incidence of diabetes and make them healthier and reduce the complications. It's not easy for a small practice in Hagerstown, Maryland, to hire a full-time nutritionist, but we made that step. But there was never any financial reward. It didn't matter if we were making a difference and improving outcomes. We are under a fee-for-service model. It just matters how many patients I deliver. And that's the type of thing, we had to abandon the project because it was expensive after several years, and there was no way to make it work. So we're looking for ways to partner with the community and with payers. Those types of innovative arrangements will make a big difference. I believe we're going to find ways to improve care rather than just treating the disease.
So with this program, you'll be able to partner with a nutritionist or a dietitian or something like that that will help your patients continually. And unlike it's already been cut off because you couldn't afford it, this helps that, and the outcomes will be much better.
Correct, that's the theory.
Okay.
Yeah, let's just say this intervention, if we had entered in an arrangement, a value-based care arrangement, and we could demonstrate real savings and improved outcomes, that savings is where we would get paid additionally for doing this. It would be a great return on investment. It would encourage others to think of creative solutions. I feel like we have so many ways to eliminate the waste, but there's literally no financial incentive. In fact, there's sort of a penalty on us for finding these solutions because it costs money to do it, and we don't get one extra dime for doing it.
Okay, thank you.
Senator Bidle?
Thank you. I wanted to ask Dr. Matthews, you talked about improving health equity because of the program that you do in DC. Give me maybe, I don't know, almost a patient example of how you've been able to address the health equity issue.
Thank you so much, ma'am. That's such a great question, and I'm really honored to be able to share our story. So with City Block Health, we recognize that, again, that the fee-for-service model, just paying for visits, I mean, that's really the summary of what fee-for-service is. It's really not about the outcomes, when instead we're recognizing that the communities that we're serving, particularly marginalized communities of color facing disparities, a lot of their needs are not traditional medical concerns. We have housing issues, we have food insecurity issues, we have transportation issues. The traditional medical system, the traditional fee-for-service model does not allow for us as a clinical group to address those issues whatsoever. In our value-based model, that's exactly what we do. We organize transportation and housing. We drop off deliveries, like I described in my opening testimony, to really look at the holistic care so that we can take care of perhaps that obese patient or that patient that doesn't have food. All of that impacts their healthcare, their well-being, their outcome. It sends them into the emergency room. It often drives them to inpatient admissions if they're eating incorrectly and they have something like congestive heart failure or the like. We're able to look at the whole person and treat the whole person because I'm not checking off a checklist for payment. I'm actually paid to take care of the whole patient, not just that patient during a visit.
Thank you.
Okay, thank you.
I don't
Well,
want to
Senator
overtake my time.
Reedy, we'd like to get beyond Bill 1 at some time to finish this one. Okay, Senator Reedy.
Thank you, Madam Chair. But this is a very important bill, very important issue, and I'm excited about the things I've heard when I talked to folks before the hearing about and hearing about. We want to make healthcare more nimble. We want to make insurance more nimble. I guess my one question to you would be, where's the cutoff where something, you talked about dealing with food insecurity in Washington, D.C., or things like that. Where is there a nexus? Because that could go along, there could be a lot of things that we do that you could say have some sort of tangential connection to good health, and certainly access to good food is important. But where's the cutoff, and how does that work in Washington? Is there, how much do you have to justify, getting somebody transportation vouchers or something? I mean, can you talk about that?
It's a great question. Thank you, sir. This is really about making sure that we're also providing high quality care. So it has to be evidence-based. And so part of that quality component within our contractual relationship is that we're not providing care that's outside of the bounds of good medical care, good standard of practice, food insecurity, homelessness, transportation, even optimizing benefits, even looking at digital access. I mean, we're really looking at all different social determinants of health that really affect those outcomes. But it has to be evidence-based. It has to be good clinical practice. And that's really housed in the fact that we, as the clinicians, are making the decisions and not the insurance plans, not the HMOs, like the question the senator provided in the last panel. The idea is that we're taking care of that whole patient, and we're doing so with the highest quality possible.
So you're making the determination that I have Mrs. Smith is presented here with such and such respiratory and obesity, maybe related issues, and so we've come up with a care plan. Is that kind of how you do it?
That is exactly
Okay.
it, sir. We have care plans, we map those out, we follow tasks, and we manage the patient, again, outside of visits. I have RN case managers that are really responsible for making sure that the patients are receiving all of the services that they need. We even have community health workers, again, a model that's not technically paid for in a fee-for-service model. I have expanded the care team so that we can really wrap ourselves around the patient.
Because, and I thank you, because because I know we've got a long day. Because you can show it, and your arrangement with the insurance company is we're not fee for service, we are, okay, so
We are fully value-based.
So you're constantly justifying that based on results, and
Yes.
they're good with it because that's the arrangement.
Yes.
So that's, okay, all right, thank you. Thanks for explaining it to me like I was 5.
Okay, Allison.
All right. Good afternoon, Madam Chair, members of the committee. My name is Allison Taylor. I'm here on behalf of Kaiser Permanente in strong support of this bill. Kaiser Permanente operates as a group model HMO in Maryland and in 9 states nationwide. We serve 450,000 Maryland patients, and 100% of Kaiser Permanente's members are in a value-based care arrangement. That's as the way that our health insurance company partners directly and exclusively with the Permanente Medical Group here, already as organized under the HMO statutes. So based on our experience, I can tell you that everything the sponsor has said about value-based care and how it increases preventive care, improves patient outcomes, decreases health disparities, has proven true for Kaiser Permanente, not only here and across the country. So, and we attribute that largely to our integrated delivery system and our ability to provide value-based care. I want to give one example related to telehealth, which was an issue that this committee considered in great detail last session, and a lot of the conversation centered around how payment was going to be made. Was telehealth going to be paid at the same level as in-person visits, and and all of that discussion, as you'll remember. For Kaiser Permanente, that conversation was not that relevant for our model because we're not reimbursing our providers on a fee-for-service basis. So if they can use telehealth and that's a benefit for them and for their patients, do it as much as you want. If not, manage your patient's care the way you see fit to do without worrying so much about how you're going to get paid, because you've worked that out already. So my time is up, but I urge a favorable report, and thanks for having me today.
Thank you. All right, and Matthew Celentano.
Good afternoon, Madam Chair, members of the committee. My name is Matt Celentano, here today on behalf of the League of Life and Health Insurers in support of Senate Bill 834. I won't go into great detail because you've heard it a bunch of times today, but and you've heard me talk about this issue in a lot of other hearings, not particularly related to this bill. But we need to evolve, and Maryland needs to catch up with the rest of the country. To improve health outcomes, number one, and to bend the healthcare cost curve, we need to get away from an antiquated fee-for-service sort of model. This committee has done a lot of work over the past couple of years on insurance affordability. And we would, contend that insurance is expensive because healthcare is expensive. This is one step, one tool to get us away from that sort of model. I've submitted written testimony with specific examples from all of the commercial carriers in the state that are actively and want this legislation to move forward so they can evolve as well, including Cigna, United, and Aetna, who cannot be here today, but you should have letters from all of them in your packet. And we appreciate the time on this issue and urge a favorable report on Senate Bill 834. Thank you.
Senator Feldman.
One question that comes up, Matt, you used the word antiquated, others have said we're an outlier. So what's been the hangup? I mean, like, we try to pride ourselves on being like innovative, creative, out front of the country, and you guys are, we have a bill here that's now all kumbaya. So what has been, I mean, I just have to ask the question, why are we like the last state in the country to go this, or where have been the issues? I mean.
Well, Senator Feldman, I would suggest that it was probably a resistance to change and being comfortable in the current system we have, but there's been a ton of work over the last year, a year and a half, including, I think, over 20 stakeholder meetings and endless back and forth to get to a place where everybody is comfortable. There are other experiences from carriers from across the country and physicians that have helped lead that conversation and explore what it would look like in Maryland. In the states that have adopted it recently, there has been a resistance to change, but once we see that there is there's lots of better health outcomes, and we actually do see a bend of the cost curve, everybody gets on board, and I think that this is something we start with and expand to much larger. We're already doing it in other parts of the state. It just doesn't make any sense for us not to be doing it in the commercial market.
One more question. So the way we're doing this here, you're saying this is sort of incremental first step, other states are further along. I'm just trying to get a sense of what we're doing relative to the other 40-some-odd states. Are we taking in a baby step here in order to get to the kumbaya thing, or are we really stepping in a significant way? Like,
I would suggest that there are other states that have expanded with no guardrails whatsoever to open up the world to value-based care. There are some guardrails on this particular approach in this particular bill, but we need to start somewhere to show the value of the program.
Okay, thank you, Madam Chair.
All right. Thank you very much, and thanks for this panel. Okay. We're going next to Lauren Grimes, Jean Ransom, Danielle Brunerian, and Barbara Mercado. These are all favorable with amendments. So we want to listen carefully for the amendments. You have 2 minutes each, and the mics are movable.
Oh, thank you. Just pointed out that the clock is wrong there.
Probably is.
Thank you.
Okay, who'd like to start it?
I'll go ahead and start. Good afternoon, Chair Kelly and committee members. My name is Lauren Grimes, here on behalf of the Community Behavioral Health Association of Maryland in support of SB 834 with amendments. Reimbursement mechanisms are not inherently good or bad, but as noted by others testifying today, they can and do alter provider behavior through incentives and disincentives. Our current reimbursement mechanism, fee-for-service, incentivizes volume. It does not incentivize outcomes, and it doesn't allow much flexibility to meet the needs of clients. We're held to the strict confines of billing codes. From a behavioral health perspective, this is really problematic. Inherent in behavioral health conditions are periods of progress, often interspersed with periods of relapse. Therefore, providers need the flexibility to provide more intensive and creative interventions when they're needed and to back off when they're not. Capitation or value-based payments isn't new to behavioral health. Maryland currently has 2 capitated Medicaid behavioral health programs. These programs serve high-need, high-risk individuals who have had multiple hospitalizations or a long-term institutionalization. These clients have significant housing, transportation, and food needs as well. The flexibility that the capitation payments allow enables staff to craft a specific array of services dictated by client needs rather than by billing codes. The outcomes of these programs have been pretty remarkable and have enabled them to reinvest in their workforce and their services. There are so many other bills before you this session seeking to address behavioral health access and workforce crises. This bill has the added benefit of supporting both of those efforts during this critical time. My colleague Lori Doyle worked with CareFirst on amendment language that would allow networks of licensed behavioral health providers to participate in these arrangements. Thank you to Senator Beidel and to Chair Kelly for including it as a sponsor amendment. We urge a favorable report on SB 834 with this amendment language. Thank you.
Thank you. Senator Klossmeyer.
Lauren, this, the first couple panels, they've been, I guess, with the physical health, but I'm hoping they look at the whole person, or which they did, but you're specifically for behavioral health. With this model, does that give you flexibility in being able to do different things with different patients? You don't have one model, in other words.
Yeah, very much so, and thank you for the question. With fee-for-service, you are beholden to very specific and prescriptive billing codes. It tells you what service can be delivered, what the service is comprised of, who can deliver it, and for how long. And so it really creates limitations around, a peer specialist might have been the staff member who has created the best rapport with a client with high needs. They cannot deliver a service whether they are the best person to connect with that client at that time or not. Additionally, when we're looking at time, a certain service under a fee-for-service model, you have to deliver it for 1 hour. Harking back to the, waxing and waning of behavioral health conditions and their chronicity, really, you're going to have clients who struggle at certain periods of time and need more of your support and more connection, and less at other times when they're more stable and their illness is well managed. Capitated payments or value-based payments give providers the ability to use their clinical judgment to say, this person is not well right now, I'm going to spend 90 minutes with them instead of 60. And when they are well, they can spend less time than that. Where under a fee-for-service model, you must spend 60 minutes with a patient, whether they need more or less of that time. So yes, it includes a number of flexibilities.
It's like if you're seeing someone for a behavioral health problem, and so often you see, and I'm just saying on TV, your time's up, get out. You don't do that.
No, capitation or value-based payments enables providers to use their time, their staff, and their resources to meet client needs as they present themselves, rather than within those very specific prescriptive timeframes.
And I would appreciate maybe offline getting together and talk about it a little bit. but
Certainly,
we're
absolutely.
good. So, thank
Okay.
you.
Gene Ransom?
Good afternoon, Chair Kelly, members of the committee. Appreciate being here. And my testimony that's written with the amendments was submitted before we reached agreement yesterday, late afternoon, evening, in the health insurance and HGO. So now I believe that there are compromise amendments. There are going to be sponsor amendments that are jointly supported by MedCai and Care First. But having said that, I think it's helpful for me to talk a little bit about the concerns we did have and how we got here. First of all, MedCai and the physician community strongly supports value-based care, and I think you heard Dr. O, who's a good member of MedCai, explaining some of the reasons why we support it. We've also been a leader in the Medicare program. We supported the Maryland Primary Care Program and helped develop that, and we were leaders in developing EQUIP, which actually is a very similar program to some of what Care First is proposing. Our concerns with this legislation has always been not the value-based care portion, it's the risk that is being shifted to physicians and patients. We worked tirelessly since last year, the bill that was initially proposed. In fact, according to my count, we had 27 separate meetings with Care First and numerous internal meetings at MedCai to work through all the issues. And I'm not going to go through all the amendments that we agreed through that process, but they dealt with things like ramp up to begin to do it, data protection, things like that. I'm not going to go through all those details. Up until recently, we had two major concerns left. One was the amount of risk that was being asked to be taken in the bill, and the bill now has a cap of 10%. Which limits the risk that a physician and their patients are taking then, which is very important to us. The second was, what do we do with regards to physicians who do not want to participate, and how do we protect them? And the amendments that we've agreed to yesterday that allows for a physician who feels their fee schedule has been lowered to file a complaint with the Maryland Insurance Commission adds the additional guide rail and protection that we needed. Again, you've heard the benefits of these value-based programs, and MedCai is a CTO in the Maryland Primary Care Program. We have practices that we're actually helping be successful in these programs. We agree with that. The issue is risk, and the issue is making sure that the right people are bearing the risk and making sure there are protections for people who don't want to participate. But having said that, we've worked everything out, it looks like, and we have sponsor amendments to solve our concerns. And I really want to thank everybody for helping make that process work out the way it has.
Now, when you send out your ads for people to join you next year, the members of the public who need health insurance, how will they know who the physicians are that are the laggards with regard to this issue, and those in MedCai who are on board with value-based? Because that would be very important to me.
So let me say this, Senator Kelly. I think that's a great question. The question, obviously, about patient and patient understanding. And one of the things that we often do is say, you need to really understand what you're signing up for and what it covers and what it is. Because there might be some patients who say, you know what, I want to be in a fee-for-service model. I want to make sure what I want I'm going to get. So I think one of the things we need to do is really make an effort to educate people and say, you know, I'm in Medicare and my doctor is participating in the Maryland Primary Care Program, which is a program today, and because of that, I'm getting extra services. Now, that's a little easier because the way the Maryland Primary Care Program works, you get extra services. You might get transportation or something else. So that's not as difficult a conversation. But obviously, that's something that's going to be very important for physicians to have conversations with their patients about it, and more importantly, for patients when they make decisions about plans to understand who they're picking, because they obviously have a choice in what plan they pick, and then they obviously have a choice about which physician they pick and which programs they're in. So I think that's an important point, Senator Kelly.
I'm thinking that all plans should indicate when the opportunity is there for people to make a decision, usually late summer or early fall for the next year, that it's value-based and an example of what that means, or that if you want to be stingy and just look at the buck your way and not to have the benefit of value, and of course you wouldn't say it in this prejudicial manner, but that they know what it is they're signing up for with regard to this issue. Otherwise, people don't know how to make good decisions.
Yeah, and that might be a better question for Matt or Brian from Care First to answer. But I will say this, I think your point is a really important one, that we need to make sure that when people are making choices, they understand what they're getting, both when they're making a choice about which insurance plan they use and what's offered. And a lot of that information is available, but it's hard for people to understand. And then secondly, when they're picking the doctor, right? Because does the doctor participate or do they not participate?
I'm about to say that,
Right.
because I've just lost 3 doctors who are all retiring. Now, I want to know that somebody I would pick as a replacement is interested in one of these models or in the other, in my case, the value-based model. So.
Well,
is
Senator
that-
Kelly, I will help you find a good doctor. I can
Well,
promise you
no,
that.
But that isn't really doing the job.
Right.
Do you guys keep a master list of docs by areas of practice that you could put a star or a cross or something to say, this one, if you're looking for this model, that, you know, some people are looking just to say what they think is a buck. And if you really want value-based in that, they will look at more than just the number of minutes you spend in their office for 3 times a year or once a year or whatever, that is value, it's called value-based and it's here.
There's 2 ways we could approach that and deal with it. One would be working with the carriers to appropriately mark their provider directory, so you make a choice there, and that's something that they would have to decide to do in a business model. There's no reason they couldn't do that. And then the other thing that might be a possibility, and I do know because MedChi is working on this project with CRISP, particularly around Medicaid, is CRISP is working on cleaning up and improving the provider directory in Medicaid. That information obviously is resulting in us producing data and information with regards to other plans as well. So there could be a possibility of putting something in there. Right now, though, the best way to do it right now is to educate patients to ask questions when they make choices about their plan and when they make choices about their doctor.
You know
But we
what
certainly
it's
could
like
work
trying
on
to
it.
reach various providers to ask questions.
Yeah.
So it would really be helpful if MedChi, since you've got to license them all, could have them designate that they consider themselves value-based or fee-for-service.
Yeah,
And you put in a little definition. There's some people who prefer the value they get from one model and others like me who would prefer the other model.
We're not opposed to working on that. We think, in fact, many of the doctors would appreciate doing that, to have the opportunity to kind of advertise the way they practice, because patients at times are going to want to pick fee-for-service or value-based. Now, the one thing I will say is these programs are very different depending on the physician's specialty. As you heard on behavioral health, it's a lot different from primary care, and primary care is a lot different from a proceduralist, right? So it might not be value-based care, it might be we participate in the Maryland primary care program and the Care First primary care program, and then that has a meaning that actually might be more meaningful to the patient. So I'm very willing, and we'll have a discussion.
Do what you can.
I'll have a
Let's
discussion
give
with the
people more
insurers and
information.
CRISP, and let's see if we can't figure out an intelligent solution to that. I think that these solutions, though, will have to probably be outside this legislation, and frankly, we probably have the statute in place to do what you're asking for. I don't think there'd be a need, it's about us as an industry getting together and having more meetings, because we've enjoyed spending so much time together anyway, and figuring out how to do that. I think you're bringing up a really good point, though.
Okay,
And I'm serious about the offer to help you find a good primary care doctor in your neck of the
I'll
woods.
talk
So
to
I'll
you.
follow up with you on that.
Okay. Danielle Ranian.
Good afternoon, Madam Chair, and members of the committee. My name's Danielle Varanian, and I'm an attorney who represents the Maryland Radiological Society. I'm here today to testify favorably with amendments for Senate Bill 834. The Maryland Radiological Society is pleased to see the changes that it suggested to ensure the protections under the Maryland Patient Self-Referral Law were incorporated into this bill, but it still does have some concerns. Although the bill includes language that those providers who choose not to participate in these arrangements can't have their fees reduced by the carrier, how these protections would be enforced is left out. I understand that Mr. Ransom just addressed that through an amendment late yesterday. MRS, the Maryland Radiological Society, represents all different sizes of practices, and there is a concern that some smaller practices may not have the same negotiating power as larger practices. The Maryland Radiological Society also wants to ensure that nothing in this bill would impact a patient's access to appropriate imaging and diagnostic services. These guardrails that are in place would ensure both access to care and quality of care, which is the main concern of the Maryland Radiological Society. With these key points in mind, the MRS is supportive of Senate Bill 834 with these amendments. Thank you.
Thank you. All right, Barbara Bricado.
Thank you, Madam Chair, members of the committee. Barbara Bricado here, and in support with amendments on Senate Bill 834, and representing Maryland Society of Anesthesiologists, Maryland Society of Otolaryngology, USAP, which is about a third of the anesthesia delivered here in the state, and U.S. Acute Care, about a third of the emergency departments in this state. And we're here in support with amendments, and they're the amendments that were referred to by Mr. Ransom, but I just need to take a couple minutes to talk about the fact that this is complex. There are lots of innovation models. Senator Augustine's question about where's the money coming from is the key question, because the money should not come at the cost of quality and access. And, you know, that's particularly of concern here in Maryland, where we have a hospital rate setting structure, and the hospitals are exempt in this new model, as I read the bill. What we've been most concerned about, and we've been talking about this, my clients and I, and talking with MedChi about this for the past year, is that those providers that are not under contract and part of these arrangements, whether they be an anesthesiologist, a radiologist, whoever they are, that they not be punished, that their rates are protected. In many cases, these physicians, as the patients, Senator Kelly, don't know that they're being treated as part of a value-based program. So the amendments that have been accepted by the House go a distance, and we think help and maybe address that problem. But I think as we move ahead, we have to really be watchful. This is a new type of model. Variations of it are in fact in place in many states and even in Maryland in different ways. But we are here to continue to work with you and support the bill with the amendments that have been accepted. Thank you.
Okay, and we want truth for everybody, and we want light to be shown on whatever it is that practice values and is suggesting is their modus operandi. Okay, and so I think that's right. Senator Reedy.
Quickly, I know we wanted to move. I was looking at, Ms. Brooke, I was looking at your testimony, and I've been looking through the bill, and I'm real enthusiastic about this idea, but you raised an interesting point. So patients, would they know they're in this model, or would they not? Or
Well,
how does that work?
I think the insurers will have to tell you how that works, but I do not know that they know they're in the model. When I ask my physicians, do you know when you're treating a patient, if that patient's in the model or not? They said, well, no. I said, well, I said, well, who would know? And they said, the patient. But then I'm not sure, especially from this discussion, that the patient knows.
Well, because
So-
I would assume sometimes a patient, you know if you're in an HMO because you chose that. So I'm
Right.
just trying to,
I think the insurers would be better equipped to
and
answer
I
that
can do an
question.
offline conversation when I'm sure
Right.
somebody will get back to
But
me.
again,
But
it
thank
depends
you.
on, just if I could follow up on that, it depends a little bit on the model that you're in. So if you're in one of the primary care models, you probably know because you'd be in the Maryland Primary Care Program or in Medicare, for example, or you'd be in the Care First Primary Care Program, and it would be clear and you'd be getting communication around that. Where it gets stickier will be as we start to launch bundle payment models around procedures, and how do we communicate that? And I will say, in fairness to the insurers, some of the amendments that were negotiated during the summer do address data and information to the physicians. So the proceduralist should know which patients are in it, and then the physician should communicate to the patients. In fact, it's in their benefit to communicate to the patients that they're in this special value-based program around this procedure, maybe a knee replacement or something else, or, so that's one of those things where I think as we develop them and move forward, we're going to have to work through those issues. And I think that extra language around data that we negotiated that was not in last year's bill and is in this bill will help that communication occur.
Okay, thanks so much for this very informative panel.
Thank you.
And we have two final witnesses, Daniel Shattuck and Beth Samus, who also are favorable with amendments. You have 2 minutes each.
Excuse me. Thank you, Madam Chair. I'm Dan Shattuck here today on behalf of the Maryland Society of Anesthesiologists. I don't want to repeat everything that you've heard, but I just want to echo the importance of the work that's been done and will continue to be done, I guess, in the coming years to ensure that there are appropriate protections for the providers who enter into these models. Anesthesia in particular and many of the other specialties that Barbara mentioned are certainly for innovation and advancing patient quality of care. I think the concern is always the level of risk that's taken on, and when you're introducing, the two-sided risk model, as we've heard described earlier by the proponent panel, it's a new entity here in the state, so we'll have to watch it grow. And I think by putting in some guardrails on the front end, will go a long way towards helping things get off to a good start. There's a lot of challenges in the healthcare community. The providers have rolled up their sleeves and they want to be a part of innovation. They want to be a part of improving the care that they provide to their patients. We're going to continue to work hard, and I thank you for your time and attention, and again, the ongoing work that will proceed from this bill.
Okay. It seems to me that the insurers might even want to hold a little contest for the providers that they serve, in which they could have maybe even college students who are pre-med or something coming up with good, catchy phrases that summarize the model that they see themselves most representing. You know what I'm saying? I think there's something we could do to make it interesting and to help educate the public about the fact that maybe various providers might be predominantly in one model or in the other model. I'm not saying one is better than the other, but for various people with different value sets, one could make more sense than the other.
Right. Excuse me, right. I think it comes down to really each practice also needs to, and provider, needs to look at what is right for their patients and what is right for their practice, because ultimately you want to make sure that you're providing the top quality care, but you want to sustain your practice to care for all the patients who may not be in that particular model or may not be interested in that model. So there's a lot of things to consider, but yeah, I
Right.
think.
And there are present and potential patients that will be interested more in one model than in the other once they understand the two. Okay, Beth Samus. Oh, Senator Augustine, you got a
Thank you,
question?
Madam Chair.
for-
Yeah, because it is for you, actually. How would it work for you, and what would be the risk in how would it work value-based, or based on kind of like the specialty of the folks who you work with?
Well, I think that has to be looked at on what is the model trying to accomplish? If it's a surgical episode, if it's, well, I'll backtrack a second. In the anesthesia world, I'd say like 10 years ago, there were discussions started about creating a perioperative surgical home, trying to create a care model that will work with the patient from before surgery, during surgery, after surgery. And we even took that model around here in the state to the HSCRC and the insurers, and it wasn't time yet because the focus was primary care and so forth. But when you're looking at a specialty like anesthesia, that's they're not volume drivers. They respond to the patients that come before them on the table. So it's really in a collaborative way, working with their surgical partners or the particular episode or surgical episode that's being looked at. But and then the devil's in the details. You want to make sure that if you want to be in a value-based plan, it's right for you, and you're not going to constrain yourself and your practice in a way that you're not able to meet patient demands in other areas outside of that model. And then you want to make sure that you're not that things are entered into in a willing and agreed upon way. So when we talked about the guardrails in place, that if you don't want to participate in a model, we don't want to see downward pressure or use that as a reason to readjust rates outside of that model. So there's a lot at play, but until we see a model, until we know what's really on the table, it's hard to really answer that.
Okay, thank you.
Okay. Yeah.
Good afternoon. My name is Beth Samus. I spent over 30 years in insurance policy, working for state and federal government, including as Maryland's acting insurance commissioner for 18 months and 3 health
Pull your
insurers.
mic a little closer to you, yeah.
From time to time, someone will call and ask for my thoughts on a health insurance matter, and this is how I became familiar with the current discussion about value-based care in Maryland. Moving to value-based care could dramatically transform our health care delivery system. While you heard much about the success of these programs in other states, the jury is still out as to whether all value-based care will meet the goal of improving quality and lowering costs. Many of the programs you just heard about focus on primary care, where the practice receives a capitation payment. Since the 1980s, we've known capitation saves money. With passage of this bill, we are likely to see more capitation for primary care providers and perhaps for others as well. After all, capitation is not illegal in the state of Maryland, but this bill will allow it to expand. We'll see if the problems capitation ran into in the 1990s are avoided this time around. The former CareFirst CEO advocated changing Maryland law to allow for one-sided risk, bonus payments for achieving cost savings and meeting quality metrics. This allowed CareFirst to implement its medical home model. Medicare has moved from one-sided risk to two-sided risk, value-based care. It is not clear that two-sided risk saves money more than one-sided risk. For example, according to a recent article in Health Affairs from November 2020, there is no empirical evidence that the addition of downside risk in the Medicare Shared Savings Program increased savings. We are embarking on a new experiment that may or may not succeed. Guardrails are needed so patients continue to have access to high-quality care. While this bill includes guardrails, I know that you have heard about the one missing, and I would support the addition of MedChi's amendment along with the study so that as we embark on this new journey, you'll have the information needed to know what's necessary to fix going forward, and I can assure you there will be things to fix.
Okay, and then you use surgeons as an example of those that might not be applicable, but they very well could, depending on, and I think they have the right to be in one model or in the other model. But suppose you're going to have a procedure, you never met the surgeon until shortly before you're going to have your procedure. If the surgeon is interested in discussing two different ways that the procedure may be done, what needs to happen for you post-operation of the procedure and so on, and do the things that the value-based model is emphasizing, fine. If he wants to be just a really great, precise, with good outcomes surgeon, then that's what he does, and he's maybe fee for service. Okay.
So there's a big difference between capitation in the primary care model and what will happen with surgical specialties. As I understand it, what Care First is proposing with a surgical specialty is that they would continue to be paid fee for service, but they'll have a target budget that will basically include all of the expected care that their patients would receive for a 60 or a 90-day period of time. And if that physician beats the budget, then that surgeon would receive a bonus. If they exceed the budget, then they will have to pay money back to Care First up to the 10% cap. And so whether or not you know that your surgeon is incentivized, because your surgeon in this two-sided risk arrangement will be incentivized to try to perform as many procedures as are appropriate outside of the hospital, and to send you to rehabilitation facilities that hopefully they understand have a good outcome, but they may select because of money. You won't know that. And I think as these models go forward, it's not clear how many physicians are actually going to embark upon this. And so whether or not, you need to worry right now about what is said and not said to patients is a little bit unclear to me. But, after all, in the 80s and the 70s, you didn't know which physicians were being capitated, right? But as this goes forward, that'll be one of the areas that you'll want to look at and, decide if you need to intervene or not. If there are very few practices that enter into these arrangements, well, why sweat it now?
Okay, thank you. All right, and that ends the testimony on this very important bill. We're going next to Senate Bill 658, Senator Lamb. Transportation, Maryland Aviation Infrastructure Impacts Commission. And let's see, we have a panel, the following persons: Calvin Ball, the Howard County Executive; Stuart Pittman, Anne Arundel County Executive; Jesse Chancellor, and Mary Reese. And we have also Dr. Jamie Banks. When the first couple of people have testified, we'll ask you to vacate your seats so that the rest of this panel can come up.
All right, thank you, Madam Chair. I think we may have lost...
The table could accommodate another one right now if you'd like, so, because the microphones are movable. Okay. All right.
So I think we may have lost County Executive Pittman to a budget and tax hearing. I think, apologize for that. I was hoping he would go sooner, but hopefully he will be able to make it here shortly in a few minutes. So thank you, committee. For the record, Clarence Lamb, Senator representing District 12. And the purpose of this bill, Senate Bill 658, is to empower Maryland communities in their efforts to address serious concerns that they're battling regarding excessive noise and environmental consequences relating to operations surrounding BWI Airport. The bill will establish a Maryland Aviation Infrastructure Impacts Commission to enhance community stakeholder influence on issues relating to aviation infrastructure surrounding Maryland communities. In 2015, the FAA operationalized the Next-Gen Flight Pass, which concentrated air traffic flight patterns and has generated numerous negative issues particularly for quality of life and environmental impacts on the affected areas in these surrounding communities. The BWI Roundtable, which was established in 2017 at the request of the Federal Aviation Administration to facilitate dialogue between the community and the airport, has been advocating for solutions to the excessive noise disruptions being inflicted on many of these nearby communities. And want to be clear, the roundtable was established at the request of the FAA. I have been to quite a few of these roundtable meetings. I know there's some colleagues here as well who have been to them. They've done a lot of great work, but there is an important distinction between the roundtable and this commission that we're looking to establish, and I'll articulate that in a few moments. Unfortunately, the FAA throughout this period, and as many who have been following this issue are probably aware, have not been a reliable partner in these discussions, and very little has been done on the FAA's part to resolve the challenges that Marylanders are experiencing and being subject to around the airport itself. So before we go much further, I do want to highlight the fact that the extent of the issues that we're hoping to address with this bill. As I said before, noise concerns are a huge problem for residents in Howard, Baltimore, Anne Arundel, and Montgomery counties. In 2020 alone, there were over 500,000 noise complaints made in relation to noise generated by the consolidated flight patterns that the Next Generation program instituted. This graphic shows the complaints relating to noise, that the noise is not siloed on a specific community, but rather issues that span multiple counties and jurisdictions across neighborhoods with significant populations, as you can see from this map. This graphic also shows the pre-next-gen flight arrival patterns. As you can see in this map, the yellow lines are dispersed across neighborhoods so that there are less concentrated effects of flight paths on individual neighborhoods. In comparison, this graphic shows the implementation of the next-gen flight patterns, again, before, after. Arrivals are significantly more concentrated, as you can tell. Notice that the flight patterns are also consolidated on paths that are subject to certain certain neighborhoods to consistent air traffic that was not present in previous flight infrastructure plans. It's also important to note that this graphic doesn't capture that the next-gen flight system also significantly lowered the altitude of arriving planes. These dual issues of concentration and low flight paths are creating serious disruptions to these neighborhoods. This next slide shows the DNL contours, and I'll explain what that is in a moment, before the institution of NextGen. DNL, or the day-night average sound level, measures the average noise levels between night and day from a specific location as it relates to aviation impacts on communities. We're showing this slide because these DNL contours, as you see here, enable those that live within these boundaries to be eligible for tax credit restitution or eligible for noise mitigation programs that help cover the cost for noise abatement, like home insulation programs that deaden the sound of planes from above. I'm also sharing these slides to show that the following expansion of the next-gen flight patterns result in a significant encroachment on these contours into Columbia and also into Anne Arundel County, which captures large populations of neighborhoods. I want to be clear that these are, quote, noise abatement benefits for residing in these areas, and they're not commensurate with the concerns that noise and environmental hazards also subject these individuals and their communities to. The tax credits and programs to insulate one's home from noise does not address the sound that they may experience when they're hosting a gathering in their backyard or their decreased property values, or help with instances of individuals seeing oil slicks in their neighborhood from residual jet fuel that may be resulting from the planes that are flying overhead. One more point about the DNL, that this metric has been built on flaws when measuring noise because it averages the sound levels between across a 24-hour period. This is the average of sound levels across a 24-hour period. Because the runways are not in continuous use, this metric doesn't fully capture the experience of a community of what they're being subject to when it comes to the dangerous noise disruptions for periods of hours before flights from this runway are finished. I'll let the panel speak more about this, but I think it is important for the committee to understand that the current DNL contours that we are employing are not capturing all the disruptions that are happening at the lower levels where they're still being harmful. Again, this is just, the DNL captures an average over a 24-hour period. So in light of this, the bill proposed the establishment of an Aviation Infrastructure Impacts Commission. This legislation delineates how many members will be appointed to the commission, which affected regions they will represent, how they will be appointed and by whom, and ensure that a diverse range of individuals who are advocates in the affected areas are represented. The Commission will seek and consider advice from the Office of the Attorney General, the Governor, the Department of Transportation, and the Maryland Aviation Administration, as well as citizens advisory groups and any other experts in the public health sector to conduct studies and make recommendations to the General Assembly to help address these issues. I do want to make clear that the Commission serves a different purpose than the Roundtable. And that's because, again, the Roundtable was created by the FAA, which, similar to the MAA, has a dual hat in this role. The MAA and the FAA serve as both the regulator and the advocate for the industry. And so it is challenging to be able to work through some of these more complex matters with the MAA, and obviously the FAA has not been quite as responsive. The MAA also may not be quite as directly responsive to consumers or to constituents like us because they're a bit more removed from directly hearing from individuals about these concerns. And so the intent of this commission is to help create a counterbalance because these airports, unlike many other airports around the country, these airports are not under some metropolitan authority or some broader authority. These are actually state-owned airports. BWI is a state-owned airport, and so it has a different jurisdiction. And therefore, we believe that it's important to have these communities that are most directly impacted by the sound be able to have a way to be able to bring their concerns together in a manner that counterbalances the dual-hatted role that the MAA and the FAA have when it comes to being both the regulator and the advocate for the industry. The Commission will have access to information on the development of new infrastructure projects that are taking place at BWI, which will be critical in providing the community with a greater voice on these projects that have significant impacts on their health, well-being, and property values. And in closing, I'd like to acknowledge that this commission is structured in a way that will provide it with the authority to conduct groundbreaking research as well on the environmental impacts of modern aviation infrastructure, which is desperately needed not only to understand the effects here in Maryland, but also around the country where many of these airports are now encroaching, or I guess the development of homes are now encroaching near these airports as well. These issues that are facing our communities are not unique to Maryland, and the findings and the recommendations of this committee can certainly be instrumental in helping to advance public progress. So with that, I will leave it up to the panel to address some of the issues that have come up. I would like to thank the witnesses here as part of this panel as well, particularly County Executive Calvin Ball from Howard County, as well as Stuart Pittman, who's the Anne Arundel County Executive, and a bunch of advocates that we have been working with as well over the last year on this bill. With that, let me wrap here and turn over to members of the panel. Maybe we can start with Dr. Calvin Ball.
All right, thank you.
Oh.
Senator
Thank
Hershey.
you. Great.
And Madam Chair, thank you very much. Just a quick couple questions for the bill sponsor. There's an appropriation of $430,000 listed in the fiscal note. Specifically, what is that used for?
So the appropriation is a mandated appropriation, and I think members of the panel who have been working on this can speak to a little bit more about what it's being used for, but it's mostly being used to help staff the commission. That the intent here is that the roundtable, one of the shortcomings of the roundtable is that it doesn't have dedicated staff. This is staff that are being utilized to help address roundtable findings and requests are MAA staff. And what the roundtable has also concluded is that it's important to have dedicated staff who can help address requests and the need for information, working with the airport itself and other stakeholders. And that's why most of this is actually being allocated to staff support.
So staff support, and is this through MDOT, or is this for the appropriation can be used by the commission to staff it in any means that they see fit?
It would be a staff, well, it would have to be through MDOT because this is, where the jurisdiction falls under. But the commission itself would have the decision over who they would hire into these positions. And so, I think that's an important point to keep in mind, that the commission wants to have the ability to, if it were set up, to have the ability to be able to determine who would help staff them. And so that's where these funds would be. Now, I will say that, we're open to looking at the mandated appropriation. And, you know, if it's the committee's desire to re-explore that, we're open to that too.
Okay, but nobody from MDOT is on this commission?
So nobody from MDOT is on this commission, although the administration can appoint someone from MDOT to be on the commission. I think the intent of this commission was to serve as a counterbalance to the efforts that MAA and FAA have undertaken to really help promote the airport. And I think the communities that are surrounding the airport are feeling like that they don't have a voice to be able to serve as that counterbalance about the concerns that have come up from noise.
Okay, I was just trying to equate this a little bit. 2 years ago, I think we passed the Bay Bridge Citizens Advisory Board, but it was run through MDTA with them providing the staffing for it. But again, in fact, the county executive from Anne Arundel was involved in also selecting some of the individuals that were on there. So I was just trying to see if this differs from that, and it seems like this is being completely removed outside of any purview from either MDOT or MAA. And
I think that was the intent of the stakeholders that we've been working with,
Right.
but we're open to, you know, thoughts and suggestions on that.
Okay, I appreciate that. Thank you. Thank you, Madam Chair.
Senator Jennings.
So reading the bill, you're focused mostly on BWI, but you say, and I guess my question is, have you looked at other airports in the state? And you keep talking about general aviation, and, you know, the state has another airport that they own, which get a lot of the, I wouldn't say commercial air traffic, but, you know, your corporate jets and everything, that's where they fly into, which is Martin State Airport in my district, which we're seeing a continual increase in the usage of that airport also. I was just curious if you guys have looked at that one, adding that into this study.
I think we're open to that. I think there was a bill, this committee, I think, had the bill, that you may recall there was a bill to look at some of the health impacts of BWI about 2 years ago, and that bill was actually broadened to look at all state-owned airports so they could account for that. And we had sponsors from across other jurisdictions that were outside of the immediate impact area of BWI as well. So, you know, broadening that, I think, is one direction that we can take with this, and we're certainly open to that as well.
Yeah, I just want, people always forget that state owns two airports.
Yeah, no, I know Martin
The other
State Airport
pair,
is, yes.
You know, not only does it have the corporate aircraft coming in, but also has all the military.
Right.
So we have a huge noise issue there. Thanks.
Vice Chair Feldman.
Well, just real quick, Senator Lamb, I'm just looking at the testimony. So MDOT is opposed to this, and they've sent in a, you know, pretty detailed letter of opposition. Have you had an opportunity to take a look at it? Because you don't get rebuttal time here, so if you.
Sure.
Do you have
Yeah.
anything you want to address while you're here?
Yeah, I'm happy to address their concerns as well as Southwest. I think they also submitted a letter of opposition. You know, I think if you look at the MAA, I think in both these, the opposition from both of them, I think there's a fundamental misunderstanding of the intent of the commission itself, that the intent of the commission is to help bring together community concerns as a counterbalance to the industry and the stakeholders who have a lot of resources and well-lined pockets to be able to advocate for themselves, but our communities who are disparate and scattered throughout the region oftentimes do not. The MAA, you know, cites the fact that there's an ongoing role for the roundtable. I think the roundtable serves a different purpose, as we kind of mentioned earlier. And the roundtable is also limited in that it is a creation of FAA and facilitated by MAA that could go away at any point in time. And I think the concerns that our communities are facing when it comes to BWI and the airport noise are ones that we're going to be living with quite a while. And our concern is that without a commission that will take a longer view and look at this, that there won't be the dedicated attention that's needed to be able to address some of the fundamental concerns that we've been seeing in our communities. And so I think the MAA, you know, citing the fact that the roundtable exists, the roundtable could cease to exist next year if they decided to not support it. The Southwest also had a concern about, you know, that they wanted broader representation from across the state. If you read their testimony, again, I think it misses the fact that they cite the fact that there are other stakeholders involved. People from across the state use BWI. There are other taxpayers that use, you know, support BWI's infrastructure and such. We understand that, we recognize that, and there's certainly stakeholders and other avenues for those folks to be able to advocate for the airport. I think what this commission's intended to do is to help bring together some of the concerns that have been heard from our communities, where many of our communities felt like they have not had a strong voice to be able to address some of the longer-term needs when it comes to airport noise around BWI.
Okay, Senator Augustine.
Thank you. I see on your list of counties to include, you don't include Prince George's County. I see maybe on the little map here, there's a couple of complaints there from Montgomery, one from Carroll, if I'm seeing this right, and one looks like it's on the border with Prince George's. I mean, what was the rationale, I mean, for these decisions?
I think we were trying to address the vast majority of the concerns that we were hearing from these local neighborhoods, and they encompass the counties that you see there. That said, I'm not opposed to broadening some of the purview of the commission to look at these other counties as well. Like I said, we did that with the health impacts airport noise bill that we had a couple years ago to look at some of the health concerns that stem from the noise that our communities are facing.
Okay, thank you.
Okay, thank you. All right, we'll go now to the panel. County Exec Ball, I understand you are the kickoff.
Yes, thank you so much, Madam Chair. I greatly appreciate your flexibility and understanding. And good afternoon, Madam Chair, Kelly, Vice Chair Feldman, and esteemed members of the Finance Committee. Again, I'm Howard County Executive Calvin Ball. It's a pleasure to be here with you this afternoon along Senator Lamb, of course, my fellow County Executive Pittman, and you'll hear from Howard County Councilmember Deb Young and many others later. I greatly appreciate Senator Lamb and his co-sponsors for their consistent advocacy for limiting the adverse environmental and health impacts on our communities. Senate Bill 658, as you know, would establish the Maryland Aviation Infrastructure Impacts Commission, conceived by the leadership of the BWI Community Roundtable, several of whom are here today. This commission would address a significant gap in Maryland's transportation and public health policy. Commission members will have the expertise and background to study and make recommendations on the health and environmental impacts of the commercial aviation flight patterns, which were implemented by the Federal Aviation Administration over 5 years ago. In Howard County, we have worked to alleviate the harmful impacts of the next-gen system as a member of the D.C. Metroplex BWI Community Roundtable since March of 2017. As a former council member, I myself sponsored Council Bill 7 in 2017, which authorized taking legal action against the FAA and U.S. Court of Appeals after several months of trying to advocate without taking that action. As county executive in 2019, we filed a second legal petition against the Federal Aviation Administration following the approval of the BWI Thurgood Marshall Airport expansion plan, one that has created more adverse noise impacts without any resolution. My colleagues and I look forward to reviewing the MDOT-funded study this fall, outlining the health impacts of this expansion in our communities. As county executive, it is my goal to ensure that all of our residents are thriving and healthy, and we will continue to aggressively advocate for those experiencing the declining quality of life due to the changing aviation patterns. Both Senate Bill 658 and its House crossfile have broad support among our Howard County delegation members, and as was noted, even though there might be opposition from MDOT and MAA, we feel strongly that the community should have a voice, and I agree with Senator Lamb that there should be a counterbalance. I thank you so much for your time. I welcome your support, and I appreciate your consideration.
Thank you. Are there any questions? All right, thank you very much. We'll go next then to County Executive Pittman, Anne Arundel County.
You better hurry, County Executive Ball, because they're doing the hearing on the highway user revenue, and if you don't get over there to testify, you might not get any money.
We want that money.
I got there first. But No, I want to thank Senator Lamb for putting this together, and as well as all the co-sponsors, Senators Elfreth, Riley, Gazzoni, and Hester, and but particularly the residents in Anne Arundel County and the Roundtable. Thank you for bringing this forward. I think this is a good faith effort. Whenever we do development, whenever there's change that will impact the lives of residents, we always bring people together and give them a voice, and that's what's going on here. So while that was done to some degree early on, and there was actually funds to purchase people's homes as a result of airport noise, it's always been known that airports create a real environmental issue for the residents near them, and noise is, if you've ever been under an airport as the planes go under, it's pretty overwhelming. And so as things like new runways are discussed, as changes are made at the airport expansions, to not have some sort of a voice for the residents and not have an assured way that the state is going to hear the concerns, not only the residents, but then the academics and the health professionals, as well as hearing from the stakeholders, from the airlines and from everybody who's a part of the whole economy around BWI Airport. We need to have that voice. So I think this is a good faith effort to do that. I was a little disappointed to see the opposition from Southwest Airlines and from the state as well. I believe that it will work well. I know that the intent of these residents, they understand how good the airport is for our tax base and the jobs that it creates. We love having BWI Airport in our county. So this is not an anti-airport effort. This is really a community engagement effort to make sure that the health impacts are considered. So thank you.
Thank you. All right, I don't see any questions. All right, we'll go next to Jesse Chancellor.
Good afternoon, Madam Chair and members of the committee. Jesse Chancellor, District 9, Senator Hester, representing the BWI Community Roundtable in favor of the legislation. The commission that will be formed if this legislation passes is necessary to provide good data that will lead to better decisions, that will provide transparency for the public, to ensure that there is a renewed balance between equally compelling and necessary interests. Complete data are missing around the commercial aviation decisions in our state because the FAA's Next Gen program was implemented without full analysis. Individuals and communities are paying the price for this failure. Public policy decisions related to our airports are therefore necessarily inadequately formed, which cannot lead to the best decisions. The process for implementing Next Gen was opaque at best and undermined public trust in how decisions about commercial aviation improvements are made. These improvements are necessary, but must be made in an open and thorough manner. Next Gen alerted Maryland communities to a sudden imbalance of interests between commercial aviation and the citizens' interests. Those interests include quiet enjoyment of their homes and the protection of their health. Our airport used to be a win-win for communities and for aviation-related growth in the state. After Next Gen, it feels like winner take all. Economic growth, tax revenues, jobs, air safety, and efficiency are in the public interest, but so too are public health and livable communities. The Commission will start to rebalance that which used to exist in this state and that allowed all interests to successfully coexist and thrive. Thank you for your time.
Thank you. Senator Bidle.
Mr. Chancellor, thank you for your testimony. And as you probably know, I'm the senator that represents the airport.
I do know well.
And when we were trying to change the Next Gen flight patterns, I attended a number of the meetings on Zoom, and all the decisions are with the FAA. So I'm not sure what this commission can do to affect the FAA's decision, because we really didn't get anywhere. I mean, they may adjust that flight pattern just a little, but nothing has happened. And so it's my understanding that any project of growth at the airport, new runways or expanded runways, all has to go through the EIS process and will be approved by FAA, not MAA. So tell me what you think really the outcome of this commission can be in affecting the FAA's decisions.
Well, Senator, thank you for that question and for your continued support of the efforts of the Roundtable, which I know you do. The commission is not designed, as created in this legislation, to address the airspace issues that are entirely in the FAA's purview. That is the role of the BWI Roundtable. The Roundtable was formed to work with the FAA and the MAA on changes, potential changes to the next-gen air pathways. This commission is entirely different. Think of it in the way of we have a police department and a fire department. They do different things, but they both support and serve the community. The Roundtable is the technical focus for all those flight path changes. The commission serves a different role. The commission is designed to bring together researchers and the community to study the effects of any improvements, whether they be soft improvements such as the flight paths or hard improvements such as expanding runways or expanding the terminal or baggage claims or anything that will add capacity to the system. And those obviously add flights in the airspace. But those are decisions that are made on the ground related to our airports, both Martin and BWI, that impact individuals in the state because those improvements result in greater capacity, more flights. And it's not designed to say that the airports shouldn't grow. It's rather designed to fill a gap in the information that's available because no current entity is empowered either through legislation or through otherwise mission to look at health, environmental, full range of impacts from the airport growth, including these concentrated flight paths. So the commission serves one role that's very different from the roundtable.
Thank you for that. My question still is, the commission can study and get results, but how are they going to affect any change with the FAA? Thank you.
Okay, Senator Hershey.
Thank you, Madam Chair. Just to follow up on this, since you have been on the roundtable and now are obviously advocating for the commission, and as you mentioned, seems like a lot more study, that you will be able to study existing information, will be able to conduct additional studies, make recommendations. Just based on your time on the roundtable and your knowledge of this, what type of recommendations do you foresee?
Thank you for that question, Senator. I've been on the roundtable for 5 years, almost 5 years. And in those 5 years, I came to it just as many other roundtable volunteers came to it as a lay citizen with no knowledge of the aviation industry or airport operations. So over the course of 5 years in trying to address this region-wide problem that was created by the FAA, I and my other roundtable members have gained a fair amount of technical knowledge around flight paths and changes and procedures. But those decisions, as the senator correctly said, lie with the FAA.
Right.
Other decisions lie with the General Assembly. These are decisions around what do we do with our airports? How much do we want our airports to grow? Where do we want them to grow? In what ways do we want them to grow? And how do we fund that? Now, those are all necessary questions because the economic benefits of our airport we all recognize to be quite important to us. But so too are the interests of these communities that are suddenly and violently in their experiences, I would say, brought into the airport environment through these concentrated flight paths. So I would see the commission, and to a further question, most of the budget would probably be available for research and not for overhead and paying, people's salaries and things of that nature. It's the research that no one really, and I think some of the panelists will speak to this further who are better suited than I am. The research will open areas of inquiry that will lead to thought about what recommendations should be made to the General Assembly around areas such as environmental protections related to airport operations. Maybe they're inadequate because we're in an environment that never existed before Next Gen. It revolutionized our airspace, but it also made most of our environmental protections related to noise pollution from aviation obsolete at the same time. So there are these gaps that we've identified as at the roundtable in knowledge around what is really the impact of all this on people that is way beyond the purview of the BWI roundtable to address. We don't have the purview. We're not suited for that. It's taken us a long time just to understand how to work with the FAA. But these are questions that we think impact communities in the state that should be questioned, should be studied, and should be debated as a part of the general discussion around our airports.
Okay. I've got some further questions, but Madam Chair, I think you want to move on. Well, let me just say, I do appreciate all that. And as my colleague mentioned, you know, the FAA is controlling the flight paths. And so I think that they're, you know, you've done as much as you can with that. They don't look like they're going to be changing that. I can see that there are other concerns that you have, but mostly from what we've seen here is it just seems to be related to the flight paths and mainly the noise. I guess you're saying there are other environmental concerns. I find it a little bit difficult to try to address so many of those when you talk about, you know, the intercommerce of aviation and airlines and things of that nature. You know, again, I fully agree that we should always achieve and ask for community input. I'm just a little concerned about this one, but I appreciate your response.
Okay,
Thanks.
thank you. All right, we're going next to Mary Reese.
Hi, Madam Chair, thank you, and members of the committee. Mary Reese, District 30, Senator Sarah Elfreth appointed me to the roundtable. I'm in my 5th year of work with the roundtable. The timing of this initiative is extremely important. Our congressional delegation has secured $158 million for the immediate expansion and upgrades of Maryland's airports, primarily that will be BWI. This infrastructure prioritization should not be conducted without consideration for Maryland communities. The FAA's implementation of NextGen was the single largest infrastructure overhaul since the interstate highways system. Its execution at BWI upended nearly a century's worth of land use planning. We have learned a lot from the FAA's catastrophic airspace overhaul. Most relevant here are limitations of the MAA and its roundtable in addressing the serious health and human impacts of airport operations on surrounding communities. Our airport authority's business model relies heavily on increases in its operations to receive FAA grants, and its revenue generation is dependent on assessing per passenger head fees. Asking the MAA to consider potential negative outcomes of its airport operations would place it at odds with its own sources of revenue. In September 2018, the BWI Roundtable presented a detailed administrative request to the MAA asking it to not undertake expansions that would increase harmful operations over Maryland communities. To date, that request has gone unanswered. To achieve balance of aviation and community interests, this commission is essential. It is impossible to manage growth if no one is allowed to say no to it. There are viable solutions to the problem we have. Senator, I believe this answers some of your questions. Establishment of nighttime quiet hours, caps on maximum noise levels and the number of operations, and noise-based landing fees can be considered through a Federal Aviation Part 161 process that is submitted by the Airport Authority but could be driven by this commission. Further, the Code of Maryland regulation has been rendered all but obsolete in the wake of NextGen. The commission will have the resources and legal standing to provide sound guidance for these and other critical and pressing aviation infrastructure projects.
Okay. Let's go to Jamie Banks. Dr. Jamie Banks.
Thank you, Madam Chair, and thank you to the committee. My name is Jamie Banks. I'm a health and environmental scientist. I serve as president of Quiet Communities, a national nonprofit, and chair the Noise and Health Committee of the American Public Health Association. Establishing the Maryland Aviation Infrastructure Impacts Commission presents an opportunity for Maryland to lead the nation for all the reasons we just heard. Decades of research show that noise and pollution from transportation in general and aviation in particular are harmful to health. Especially vulnerable are airport workers, children, seniors, and those with pre-existing conditions. Aircraft noise disrupts activities and sleep and causes stress responses that increase high blood pressure and the risks of heart disease, stroke, and mortality. It contributes to anxiety and depression. Low-frequency noise and nighttime aviation noise are especially hazardous. A recent study showed that quieter skies during the pandemic improved cardiovascular health. Aviation noise impairs children's learning and cognitive development. Sound insulation in affected schools and airport relocation away from schools have been shown to reverse those effects. Aviation noise impairs work productivity. Aircraft emissions contain fine and ultrafine particulate matter. Fine particulate matter is a human carcinogen, known to cause diseases ranging from lung and heart disease to cancer, reproductive and developmental disorders, and premature death. Emissions in communities under concentrated flight paths are of particular concern. Noise and particulate matter have been associated with the development of dementia. Noise and pollution are also environmental stressors, diminishing environmental quality and contributing to loss of biodiversity. All of these impacts come with substantial economic cost. An independent commission free of vested interests is needed to determine local impacts to inform solutions that protect health and environment while supporting operations at BWI. Maryland has a unique opportunity to effectuate change. Thank you.
Let me just ask a question. Do any of you on this panel have a good idea of what you would consider to be a solution? I'm not talking about who should do this solution, but what do you want to see done that's fair to the airlines, and also that, and of course your concern is the community. So let's just focus on the community. What would you want to see done?
Well, I mean, I think there's consensus that the flight paths from Next Gen were a problem, and that there was an effort by everybody in this room, I think, or the state, including the roundtable, to try to change them. And as Senator Bidle said, they didn't listen. It was very frustrating for all. I believe that this commission can create information and can show other jurisdictions as well around the country the information that they're building to make that case even stronger. So my feeling is we don't walk away and give up because we were told no at the federal level, but that we reconvene, we organize, and that this commission is part of that so that we can continue to fight the good fight to change the flight paths.
Madam Chair, can I add on to that?
Yes.
So when I spoke to the FAR Part 161 process, that is the only avenue that a local jurisdiction has to ask the FAA for quiet hours, restrictions on certain types of loud platforms, caps on operations. And that process is very detailed, and the MAA has not engaged in that process despite years of the roundtable's requests. So gaining relief at night would be a huge step forward for Maryland residents who are impacted by these paths. It may not totally fix the problem, but it's a huge step forward. And I think the roundtable in its existence is important. It's chipping away at the edges of the problem to the best that it can, considering the special interests that are involved and that the revenue for the FAA and MAA is generated by a per passenger tax. So it's doing its work and it's listening to the communities, but we have to have this scientific data to create a cost-benefit analysis from some other perspective than just the benefits that the airport and the airlines present.
Okay.
Madam Chair, may I make a correction for the record? I don't want to leave the impression after this panel that the FAA has completely turned down any changes at BWI. That is not the case. We've been 5 years into this process, but they are currently reviewing a set of flight changes which may make improvements at the margins of the problem. But it is not a solution. It will not change the negative impact of these flight paths on most of the people that are now subject to them. But we have, with our partnership with the MAA and Southwest Airlines, quite frankly, who've been good partners to the roundtable, we have been able to get the FAA to consider some changes. We expect them to come back to us in the next few months to tell us what their initial review says about those possible changes, but they are minimal relative to the problem. I just want to correct that record.
Let me ask one other question. How broad, in terms of number of miles from where the flights take off and land generally, are most of the residential areas, would forcing the FAA to back whole communities or people's homes help?
Thank you for that question. I'll let my panelist partner pick up on it as well. We were told by the Maryland Aviation Administration in one of our earliest committee, BWI Community Roundtable meetings, that before NextGen was implemented, BWI had no noise problem. And that's evidenced by, and I'm going to make a correction, that's evidenced by the number of complaints outside of the immediate environs of the airport. The airport has always had a noise problem close in. The problem that NextGen created was far out, as well as close in. So that communities, we are getting testimony, and you can look at every meeting we have public testimony. Citizens come and tell us their experiences. People of 10, 15, as much as 20 miles away from the airport suddenly feel like their properties have been annexed to the airport because of the concentrated noise pollution that they're experiencing. Some of them are aware of other types of pollutants. So to have a purchase program for the affected communities would reach far out into Howard County, far out into Anne Arundel County. It may be limited by, a mile on either side of the flight paths, but that's, hundreds of thousands of citizens.
Okay, one other thing. Do you know of any other airport in some other state where there was a similar problem that has been solved in a way that is reasonable for both the residents and for the airport? Do you have any model that you could follow?
Well, Madam Chair, our roundtable has actually achieved more success in working with the FAA than any other roundtable in the country. We are the first roundtable to actually have simulated flight path solutions presented within the performance-based navigation group with the FAA. So we've opened a door. However, I did see the MDOT's unfavorable response to this bill. And in that response, it seems they've stated that they believe that was a comprehensive solution that we've offered the FAA, and when the FAA comes back, that the roundtable would no longer have a purpose. And the roundtable has made it clear that that was not a comprehensive set of solutions that was presented. So I was a little bit concerned by the MDOT's response there. We've made it clear it's not a comprehensive solution. It's far from it. And in fact, these paths are so concentrated that at this point, they're just being moved back and forth, and it's creating winners and losers. It's putting it over one person's head, and then maybe they can band together and fight, but then it's just going to be moved over more unsuspecting people. And the problem is, if you're increasing capacity of an airport, you're going to create more flight paths. That's a fact. So if we're growing our airport and then we're going to put in a new runway that's on the horizon, Amazon's created a huge cargo hub there that happened largely in secret. These paths are going to continue to show up over more and more communities' heads. And we have to do something to include the communities now.
And I think that addresses also your first question that you had, Madam Chair, which is, where does this go prospectively? And I think the intent here, because it's an infrastructure impacts commission, is intended not just to look at next gen. But to what Ms. Reese was saying, there are going to be other infrastructure projects taking place at the airport as well. And I think it's important to have the community's input as part of that process, and that's what this commission hopes to do.
Okay, thank you.
Yeah, Madam Chair, if I could just say a couple of other things.
You know what, I can't right now, but give me a call. I'm willing to talk to you. We got to follow other bills.
Okay, fair enough.
Other people are waiting. Okay, Jeff Stagg, Ann Collins, Zafari, Deb Young. If you would come and take your seats, you have 2 minutes each. All right, the mics are movable. Everybody has 2 minutes. So someone could get started.
Start with me. Thank you, Madam Chair, and your committee. I must admit that having listened to all the experts, I'm more confused and more concerned than ever. But my name is Jeff Stagg. I arrived in Annapolis 41 years ago after competing in a yacht race around the world, and I have worked out of Eastport for those 41 years, running a very successful yacht brokerage company that utilized BWI and surrounding airports a lot. I own a building in Eastport where the Bakers & Co., some of you may be familiar with that, are based, and I have recently retired. I strongly support this legislation because the airport noise has really come to affect the quality of my life. There is no question about it. I don't want to bore you too much with this, but I have had 2 kidney transplants of recent times, and when this next-gen stuff came into operation in roughly 2015, I think it was, I was pretty much out of it on dialysis. I had a transplant in 2018, my second one, which was fantastic, and I became much more aware of my surroundings and environment. And I can't tell you how bad it has become. Without being too exaggerating, I swear that at times they're trying to land on my roof at 6 o'clock in the morning, at 10 o'clock at night. I mean, it just seems to be they dropped the ceiling heights down, I don't know, 5,000 feet or whatever, and concentrated all the flights into 1 or 2 flight paths. And it has severely disrupted the quality of my life. You know, what concerns me the most, and I will stop after this, that to find that actually the airport is owned by the state of Maryland, but it has no control over the affairs of that airport thanks to this FAA, and we can have no input into this. I'm really quite speechless with that all this can be done without the input of the people that are most affected. Thank you for your time.
Thank you. All right. Who'd like to go next? Ann Collins?
Good afternoon, Madam Chair and members of the committee. I support this bill, SB 658. My name is Ann Coles. I live in Montgomery County. I've lived there for 50 years, and I live 30 miles from BWI Airport, but the airport has come to me. Sadly, I don't really want to live in Maryland anymore. I was a person that enjoyed nature, peace, and quiet. I no longer have been able to do that since next-gen sat-nav was installed at BWI. The noise and pollution is relentless, and the sky directly above me is thick with jet exhaust and particles. There's a wide plume of polluted air constantly, and there are never any clear skies. I have a wide open space because I have a horse farm, and I can look to the left and right, and I can see these huge plumes of pollution. So no longer do I get a clear sky at any point, really. I have records and photos, and I can ascertain all of this. Even though most of my time is spent outdoors, where I am subjected a lot to the aircraft, noise, my sleep is also constantly disrupted, and it's even hard to read or concentrate inside my home. I have to run background noise from TV, radio, air purifiers, etc. My health is being affected by the noise and pollution. In the 20 minutes that I wrote this, typed it up, there had not been one whole minute without thundering jets. I really don't want to leave. I have a vibrant business that I established here in 1972, but I feel like I'm being forced out by BWI. I board and train horses, I teach riding lessons, and I have provided jobs. I've got many happy clients. I've been a respite for Marylanders during these stressful times of the pandemic. And I am highly regarded for keeping my business available for my clients and neighbors. The FAA and the MAA purposely used green space to fly their routes. This is really bad because no one can really enjoy a park setting when it's constantly bombarded by jets and air traffic. Thank you.
Sounds like we might need our federal delegation involved. I mean, since the FAA really is the highest entity in terms of, with prerogatives to really do something meaningful. Okay, let's hear from Zafar Safari.
Thank you, Madam Chair and esteemed committee members. Thank you also for the opportunity to be here. My name is Zafar Zafari. I'm an assistant professor at University of Maryland School of Pharmacy. I am health economist, and my research is mostly developing decision analytic models to quantify economic benefits and health benefits of interventions and health policies. Today I'm here to strongly support this legislation, namely SB 658. As we all know, the expansion of the airport infrastructure potentially lead to economic growth and economic prosperity and create jobs. Nevertheless, the public health impacts and environmental impacts and threats of noise have been reported in the literature multiple times. For instance, we have several evidence that aircraft noise has been linked to cardiovascular diseases, anxiety, reduction of quality of life, sleep disturbance, cognitive function impairment, low birth weight, and the list can go on. Therefore, the public health and environmental effects of noise should be quantified, especially in impacted communities, those people who are living beneath the noise corridors of these aircrafts. In addition, the trade-off between the economic growth and all those public health concerns should be quantified. And we have this recent study published in American Journal of Preventive Medicine that shows only 5 dB, 5 decibel in noise could be associated with $3.9 billion annually in medical economic burden to payers. And that's only 5 dB, and they only modeled hypertension and coronary heart disease. We all know that we have more health effects and endpoints. Another point to add is that the vulnerable and health disparity population should be identified. Those people who are directly impacted by noise. And their voice and their concerns over noise should be heard, prioritized, and incorporated into decision-making process about aviation infrastructure expansion. Because at the end of the day, these people are, incurring the burden and the higher medical costs. And as we all know, before the pandemic hit, every year there was a growing number of noise complaints and annoyance in Maryland. So I think it is essential that the voice and concerns of these vulnerable population be heard.
Thank you very much.
Right. Yeah, I think finally I'm all in support and favor of the bill SB 658. I think this bill provides an outstanding and unprecedented opportunity for studying the public health and environmental impacts of noise. And I think it has potential substantial benefits for the well-being and public health of Maryland residents. Thank you.
Thank you. Let's hear now from Deb Jones.
just going to say, I'm a council member. I get 2 full minutes. I know what that means, okay? I watch that clock. My name is Deb Young. I am a county council member in Howard County. I'm also a member of the Round Table. Good afternoon, Senator Kelly, Vice Chair Feldman. It is a pleasure to be here today. I thank all of you for your patience and your listening ears. I know I do actually really understand what it's like to be in your seats. I'm here to testify about a couple things, but I do want to answer the senator's questions because I think that that's really an important part of why you have hearings like this. I want to tell you that first, I have been on the roundtable for 3.5 years. I have heard from lots of residents about the noise and environmental pollution from Next Gen. I not only represent District 4 on my county council, from my county council, but I represent the entire council-manic, the entire county. So I represent all 5 council-manic districts as the representative for the council on the roundtable. And I can tell you, as a result, and I know you all will appreciate this too, my colleagues, I guess they, as well they should, tell their residents to contact me when they have issues with BWI noise. So I get the emails from everybody throughout Howard County who are having issues with BWI. And actually, it's a good thing because I understand what they're going through. I live under that highway in the sky, and I know how difficult it is for them. So 24/7, it is not a pleasant experience. Now, I do want to address, I think, what is the most important question here that you all have asked over and over again. What can we do? The FAA controls this situation. Why are you coming to us and saying that we need a commission and the Senate might get involved? Here's what you can do, and it will have an amazing impact. This is a state-owned airport, as is Martin Airport. And thank you, Senator, for bringing up Martin Airport. Both of these are state-owned airports. Where does the money come for this expansion? Who made the decision that was announced yesterday that we would add 3 new airlines at BWI? That was our airport that made that decision. Who's going to put in the cargo expansion? Who gave the money for that? Who approved it? That was our government that approved that. Who is approving the money for the new runway? That is our government that is approving that, our state government. And when you say, I don't think that we have any power to do anything about this, if we were able to give you the data and the science as to why you should not be approving those types of things, you here in this state legislature can say, enough is enough. And if you say, enough is enough, it can't happen. And when it gets to the point where it can't happen, guess who comes to the table? The FAA. That's who comes to the table. So if nothing else, you can use your legislative powers to make a difference here. And I'm begging you to do so.
Thank you. All right, and did you get to testify?
Thank you.
Okay. All right, so that's this panel. And then our final witnesses are Laura Donovan and Mary Kremsner. You have 2 minutes each. And the microphones are moving.
Okay, great.
Hi, I'm Mary Kremsner. Good afternoon, and thank you, Madam Chair and members of this committee, for the opportunity to speak about the human cost of FAA's Next Gen, which created an extremely narrow and low flight path through which flights arrive at BWI. MAA directs air traffic to fly day and night over our homes as low as 1,000 feet with no federally mandated noise limits. I know firsthand noise remediation efforts do not work. We built our home in Severna Park in 2012, completely unaware of the next-gen implementation in 2015. When it began at our own expense, we added extra insulation, bought triple-pane tempered windows, designed for commercial buildings, and added thicker drywall, all the things you're supposed to do to soundproof a home. It made no change whatsoever. We had to keep our windows closed all the time, and we had intense low flights flying over our home every 1 to 2 minutes. The MAA has heard from many communities, especially Severna Park and Millersville, about arriving flights. MAA was successful for years to discourage reports. Their website made it nearly impossible to lodge a complaint with 10 required fields, limits on the number of complaint submissions. And it takes about 4 minutes to complete a complaint online. However, it only takes 3 minutes for 2 flights to fly over your home. So the math speaks for itself. You cannot build a tolerance to the intense and frequent noise that we experience. You know, for years, the Roundtable's been working to broker a smart and equitable solution. As an observer, I've watched MAA and FAA stonewall, and everyone drops off due to frustration. So after 5 years, we decided it was in our best interest to move, sell our dream home. We sold it for less than the value, purchased a home in Crownsville, and after consulting with MAA to identify an area that is not experiencing next-gen flight paths. Unfortunately, my marriage did not survive next-gen. I'm here today as proof of the human toll. My family is forever broken, and now my worst fears may materialize. The flight paths may be changing again. They might be soon coming over my home in Crownsville. In closing, I just want to thank you for supporting this hearing and the welfare of Maryland residents. Please save our communities and particularly our families. Thank you.
Thank you. All right.
You done?
President.
No, I used my time.
Hi, I'm Laura Donovan, law-abiding, tax-paying citizen. I live approximately 2 miles from BWI. This statement may sum everything up. This is from an Office of the Inspector General for the FAA. It gets a little technical at first, and it's very short. Addressing community concerns and implementing controller tools for PBN. It has to do with navigation. PBN has been delayed due to community concerns over aircraft noise. While regulations did not require FAA to fully assess the impact of aircraft noise, it could have anticipated this issue due to high public interest at other airports. This is being dumped on all of us. I know this isn't your ballpark. We know where it's coming from, but any assistance would be great. My very practical problems are I get so little sleep, I cannot function in a workplace. I always have to prove myself. I know you can't see these. These are basically for me. I live now on a high flight path. I live on a military helicopter flight path now. I have small planes. I have, and here's where I start getting real concerned, I call them the splat marks on my roof. And given that people have oily swimming pools, I suspect it's petrol-based. I wanted some solar panels, but I'm losing the credit because I called MDE and the EPA, who told me to call the FAA to find out what my splat marks are. I'm losing my hearing. I've been telling the MAA and the FAA for years. Somebody had the nerve to actually ask me if my health insurance would cover that. I accidentally found something online about pressure cracks in windows. I highly suspect that my 4 broken windows are from helicopters. I would love to have some proof of this. I also found out that to get the high test windows, it's going to be $3,000. I have 21 windows, 3 doors. I also have chimney mortar shaking out. I have 16 nail pops and a bathroom that faces the bathroom, or a bathroom that faces the airport, excuse me. My house is being torn up. My health is being torn up. If this continues, I may wind up being the first in my family and forever to ever go on welfare and food stamps. I am not proud of this. I could cry you a river. I would only embarrass myself because I don't like doing these things. We really need your help. Anything you can do. I can corroborate everything that everybody has said. That's all I can say, basically. Just please help us. I'm very much in favor of 658, and this is not said with blame, but this is long overdue. Very long overdue. We need your help.
Thanks very much to both of you. Okay. All right, we're going next to Senator Heddleman, Transportation of Persons with Disabilities, Transportation Network Companies, Employee Requirements, Senate Bill 625. And you have a witness from the Maryland Transportation Authority, Holly Arnold. All right.
Thank you very much, Madam Chair, Mr. Vice Chair, members of the committee. I'm Shelley Heddleman, a senator from District 11 in Baltimore County, and I'm here today to talk to you and share with you some problems that many of my constituents have been having. So many of you who live in the Baltimore area might be having the same issues with your constituents, and that is that people with disabilities often have to rely on transportation services provided through MTA, through a program called Mobility. And these are people who are unable to go to a bus stop or be unassisted at a stop or at a train station and can't do it by themselves. So they can avail themselves of the Mobility service. We have been getting, for many years now, calls from constituents who are really frustrated with the service that they've been able to get through Mobility. And I will have to say, since Holly's here with me today, that they have been trying to be very responsive. They have been open. To their credit, they have met with people. They are responsive to our concerns when we share them with very specific horror stories that our constituents share with us about being stranded in the rain, about here in my testimony, you'll see a 5 to 8 minute trip took over 110 minutes for someone. I mean, these are people who have to rely on this service to get to doctor's appointments, to get to the grocery store, to get to other places. And one of the challenges, as you all know, as we all have heard, is hiring people to be drivers. This bill would enable MTA to expand some of their transportation services to places like Uber and Lyft. And one of the things that is in law right now in MTA's is they have to be fingerprinted. And what this bill does is pretty simple. It changes that requirement, and it says that they would have to comply with a criminal background check. I'm going to let, because I know you've had a long afternoon already, I'm going to let Holly go through some of the details, but this bill will ensure, I think the provisions that we have in it will help to make sure that the drivers are going through that criminal background check. And we have a slight amendment because in the bill it references a trade association, and what we really want to make sure is that these companies are covered under the Fair Credit Reporting Act. So it's just a little clarifying amendment to make that clear. So without further ado, I'll turn it over to Holly, if that's okay.
Okay.
Thank you.
You are aware we are having problems here at the end of the pandemic. I hope it's the end, with having enough Uber drivers and Lyft drivers and so on, and they're losing them.
Absolutely. I will say too, though, this problem existed before the pandemic too.
Okay.
So.
Thank you. Thank you, Chair, members of the committee, for allowing me to be here today. For the record, my name is Holly Arnold. I'm the administrator of the Maryland Department of Transportation, Maryland Transit Administration. I'd really like to thank Senator Heddleman for taking the lead on this important legislation. I'm here today in strong support of this bill, as it will allow MTA to improve our paratransit service in an innovative way. So as you may know, MTA provides mobility paratransit service within 3/4 of a mile of our fixed route service for people with disabilities. Throughout the pandemic, a sizable amount of our mobility operators left employment with our current contractors. As the region is recovering from the COVID-19 pandemic, our riders have been coming back, and unfortunately, the mobility operators really haven't. We've investigated several ways to increase and improve our mobility service, and we believe that one of these ways is contracting with TNCs, so transportation network companies such as Uber and Lyft. It would be an effective and immediate way to accomplish this and provide options for our riders. I should note that our industry peers do use this, including WMATA in this region. So this is currently operating in the state of Maryland in the Montgomery and Prince George's counties. Our goal for the Mobility TNC program is operating very similarly to the current Call a Ride program. So this is an entirely optional and supplemental program that customers can opt into. There would be no change to how they access our existing mobility service. This is just another option that they can use. In our existing discussions with the TNCs in the region, they conveyed that the fingerprinting requirements are a barrier to any kind of contractual agreement with MTA. In the law, the fingerprinting requirement is specific to MTA and our contractors, and again, doesn't impact anyone else in the state. Passing this bill would allow MTA to contract with TNCs and provide the service similar to how WMATA is in the state. Currently, the TNC drivers are required by the Public Service Commission to undergo accredited criminal history checks yearly, and that would change. And as an added layer, that would not change, sorry. And as an added layer of protection, this Senate bill codifies those regulations and allows MTA to adopt more stringent standards if we need. In closing, the operator shortage that currently exists threatens the vital service that mobility provides. This Senate bill will directly address this problem and allow MTA to offer a new innovative service that will keep our customers safe and on the move. It's for these reasons I respectfully ask the committee for a favorable vote on this bill, and I would be happy to take any questions.
Senator Augustine?
Thank you. I will be brief. I recall it was with the TNCs with disabilities ride, not necessarily with the Uber and Lyft folks, and that there really were actually more control, actually. Is this, I mean, which group are we talking about here?
So this is a new program that we would be offering. So MTA mobility service would stay and remain the same. That service is something you have to call ahead about a day in advance and book that service for a ride the following day or a future day. The Call a Ride program is operated with taxis, and so you can call same day. It's an opt-in supplemental program. We don't force people to use it. It is non-shared ride. Our mobility service is a shared ride service. It's also a curb-to-curb service versus a door-to-door service. So anyone who needs that extra assistance will take MTA mobility.
Yeah, no, I remember. I mean, that's the same thing, but it's not Uber and Lyft, I guess is what I'm trying to say.
Yeah, we just use taxis.
Yeah,
so
it's
this would
taxi
be
service. And I'm going to let you know, I'm going to try to go back and look because there were concerns about the safety of folks with disabilities, with folks, and we've had some pretty horrific things that have occurred, actually. And so there's just really is concern when you have people with disabilities that you aren't really cautious about who you're, who's giving rise to these people who are, pretty vulnerable. And so I just put that out there, like that's something that I think about when we are, doing this kind of thing.
So absolutely, completely agree. The safety of our riders is first and foremost in our minds, and we never want anything to happen to them. It is important to remember this is an opt-in service. So it's something that our riders can choose to use. We will never force them onto a vehicle that they're not comfortable being on.
I understand that. The concern was with the drivers. It wasn't with the people. Like, we've had drivers who were, ended up being problematic with regard to what happened to passengers. And so that's where the background checks and the fingerprinting were good things to get a sense of knowing who we're transporting, the people who are these vulnerable populations. I'm just letting you know. So
Yeah, absolutely, I understand. And again, our MTA mobility operators do continue to go through that fingerprint process.
Right.
This is the opt-in service. And the PSC Commission has pretty extensive background check requirements for Uber and Lyft. I think Maryland is one of the stricter ones that has been put into place. It's annual background checks. It's a pretty thorough check. They also go through, they have to do it annually. If there's anything that comes up, they're required to report it. There's regular audits. And so far, there's been no evidence to kind of suggest that the fingerprinting is more stringent than the background checks they've gone through.
Thank you.
Senator Feldman.
I just want to echo that because this is the committee that dealt with the whole Uber Lyft thing vis-à-vis taxi cab. We spent 2 years dealing with background checks that the taxi cabs drivers would do versus Uber and Lyft, and we worked pretty darn close with the PSC. This was a 2-year odyssey to come up with what I think, was a place where absolutely, like the fingerprint thing might seem like it's going to solve, but in fact, the PSC, we did come up with, I think, really strict rules for Uber and Lyft. Because you may talk about people with disabilities, that was a bill that dealt with our entire public. Like anybody getting into an Uber and Lyft should be, safe and feel safe and that kind of thing. So anyway, I'm comfortable because of that experience that this acknowledging Senator Augustine's very legitimate point that, we have some really strong stuff here for Uber and Lyft drivers as a result.
Yeah, I'm glad to hear about this because I have a gentleman who's still calling me from the last time we were trying to work on something. They wouldn't come within 3/4 of a mile of where he lived with the mobility van. And they wanted him to take his wheelchair and drive up what was a hilly public road to get to the nearest place they were willing to come. So if the Uber drivers could pick him up where he lives so he could get his meds and go to the doctor, that would be helpful.
So I can't fully promise that this will solve that problem because we're still going to operate within 3/4 of a mile of the fixed route service.
I've got a lot of people, and a lot of us all do, who live on country roads that aren't being served. And these are elderly, we've got to adapt. What can we do? Maybe we ought to just put something in the bill as an amendment to provide door-to-door service if we do this.
We can definitely look into specific situations. There are other nonprofits and some of the counties that provide some of those services.
There are human beings and taxpayers who are elderly, and I went to meetings with the MTA for 2 years, and all they could tell my person was, because you're in this location, as a taxpayer in Baltimore County, you've got to drive up 2 roads where there are no sidewalks and go 3/4 of a mile from where you live in order to get service. And then that's the way you're going home. So that was nothing.
No, and I absolutely sympathize with that. This is
So go back to the office and tell them, we like this idea if they can serve everybody.
Yeah, so this is an ADA federally mandated service, and so we do have to stay within the FTA guidelines. That said, there are other services that I think we can make sure that we're putting your constituent in touch with.
Get back to me with the list of the other services.
Yeah, we'll follow up with that.
Okay, thank you. Are there other questions? Okay, thank you. All right, Senator Sidnor, Senate Bill 766.
Thank you very much.
Thank you. Commercial law, consumer protection, genetic information privacy. And I'm going to call up your panel. Catlin McDonough, Hannah Abrams, and Richie Englehart.
All right.
Those people are here. Okay. And Mr. Sponsor, you have as much time as you need to lay out the parameters of your bill, and then each witness will have 2 minutes each.
Thank you very much, Madam Chair. Senator Charles Sidnor, for the record, testifying in support of Senate Bill 766. Last year, we dealt with a direct consumer to genetic testing on the criminal side, genetic genealogy. I had convened a work group that was looking at how our genetic materials was being used in genetic genealogy. And at the tail end of the work group that I had an opportunity to begin speaking with representatives from 23andMe and Ancestry.com as we were looking at last year's bill to see how we might be able to attach some laws with regards to the consumer aspect of it. But given the complexity of last year's bill, what I had promised these organizations was that I certainly believe that we should do something in the consumer area, but last year's bill just wasn't that. We wanted to focus on the criminal use of genetic testing and genetic genealogy. So this year, that's why we have this bill in front of you. So since we've dealt with the criminal, now we're looking at the consumer side of things. And in the past, we've had some of these companies that have done some things with the consumer's DNA that at times went against its own policies that it had on its websites, essentially violating, I believe, those people's or those consumers' rights. So as genetic testing services have become more prevalent in the marketplace, so has the need for up-to-date consumer protections for their unique personal genetic material utilized to provide these services. Senate Bill 766 intends to provide consumers protections which they do not currently have, and thereby put them in control of their genetic data at all times. Senate Bill 766 regulates direct-to-consumer genetic testing companies that use consumers' genetic data by requiring them to provide consumers with clear and complete information about their policies and procedures for collecting, using, or disclosing genetic data prior to the consumer sharing their DNA. These policies and procedures must be publicly available and placed in a prominent place on the company's website. Senate Bill 766 also notes that these companies must, prior to collecting, using, or disclosing genetic data, obtain a consumer's consent. That consent must describe the uses of how consumers' genetic data will be used and specify who will have access to genetic testing results and how the genetic data may be shared, as well as the consumer's express consent for transferring or disclosing their genetic data to an unaffiliated third party. The direct-to-consumer genetic testing company must also disclose any use of the consumer's genetic data beyond what the consumer's primary purpose of engaging its marketed services, among other kinds of consent. This bill requires that these companies establish legal policies and processes for releasing to law enforcement or other government entities genetic data without the consumer's express written consent. And the companies must also develop, implement, and maintain a comprehensive security program to protect the consumer's genetic data, as well as a process for the consumer to access their account, delete their account and its genetic data, and request the destruction of their biological sample. Because as you all know, once your DNA is out there, it's out there, and it could be dangerous. If a direct consumer genetic testing company violates any of these requirements, this bill provides consumers with the ability to hold them accountable for an unfair, abusive, or deceptive trade practice. It also expressly allows a consumer to pursue any other legal remedy provided by law. For the aforementioned reasons, I ask that Senate Bill 766 be reported out favorably. And on my panel today, we have a number of witnesses from the industry.
Okay. I do have a question of the sponsor before we go to the witnesses. This is definitely much needed. How, when these companies are often international companies, are we going to be able to police what they're doing or to get redress for Marylanders who either won't know what their rights are and what the limits are supposed to be, or who, even if they know, are violated anyway?
Well, I would believe that any of these companies that are doing business here in the state of Maryland are going to have to follow the state of Maryland's laws. So if they need to register to do business or whatever, they would still fall under this state's jurisdiction in this particular law. So I don't think that should be an issue. But in addition to that, and maybe our panel witness from Ancestry might be able to confirm what I'm saying, but I believe most of your consumers here in the United States, they're just a handful of companies that really are the big companies that people are using. That's Ancestry, that's 23andMe. Some folk, they use GEDmatch, and there may be a handful of others, but most of those companies are right here in the States.
Okay, we'll listen to your experts. Okay. Who's going first? We have Caitlin McDonough, Hannah Abrams, and Richie Englehart.
Yeah,
I'm going to defer to Richie first and then I'll kind of
Okay,
discuss some amendments.
okay,
Thank you.
Richie.
Good afternoon, Madam Chair and members. I'm Richie Engelhardt, Head of Government Affairs at Ancestry. Along with our coalition partners, including 23andMe, we support SB 766, a bill that will ensure that Maryland consumers have the strongest protections for their genetic data. We've supported similar bills in Arizona, California, and Utah, where the measures passed with bipartisan support and broad stakeholder consensus. We are offering amendments to address some of the concerns raised by pharma and the AG's office, which more clearly limit the scope of the bill to DTC genetic testing services, therefore allowing us to remove the broad exemption for higher ed that the AG's office has requested. I do want to address the AG's other concern regarding de-identified data in their written testimony. The exemption for de-identified data in this bill tracks to both HIPAA and the Common Rule, the federal laws that govern privacy in the healthcare and research settings respectively. The bill before you would provide stronger protections for genetic data than either HIPAA or the Common Rule, and these strong protections have long been a part of our terms of service and are already in statute in other states. In fact, the very California law that the AG's office asked to align this bill's genetic data definition also includes an exemption for de-identified data, as do the General Consumer Privacy Acts that have passed in California, Colorado, and Virginia. This bill only allows an exemption for data that we have committed to use in de-identified form, take measures to prevent the data from being associated with a particular customer, and contractually forbid anyone we share the de-identified data with from even attempting to re-identify it. This is the standard for de-identification in HIPAA and the Common Rule, other state privacy laws, the Federal Trade Commission, and the National Institutes of Health. If Maryland alone imposed further restrictions on the use of de-identified data as defined in the bill, it could have a chilling effect on biomedical research. We are working to find common ground with the AG's office on some amending language, but we would urge the committee to favorably report SB 766 without the suggested amendment on de-identified data if we don't find an alternate solution. Thank you, and I welcome any questions the committee may have.
Okay, you did mention 3 states where you already have done work. I think on someone else's bill, we've heard about what was going on in this regard in Virginia. Is the Virginia plan?
It's a different set of issues.
Well,
yeah.
Okay. All right. He thinks I'm off the board that his plan.
It's a different issue. It's Malcolm Augustine.
Okay, all right. Okay, well, let's go. All right, I'll come back later. Did you have your? No. Okay, all right. Then we'll go on to our next
If you
one.
want to co-sponsor, Senator, we'd love to have you. Thank you, Madam Chair. Caitlin McDonough for the Coalition for Genetic Data Privacy, which, as Richie mentioned, includes Ancestry and 23andMe and the vast majority of the direct-to-consumer genetic testing industry. And just an answer to your question, Madam Chair, that I think may help clarify, and Senator Sidnor alluded to this in his testimony, not only does this guarantee certain consent rights to the consumers who are using this, it makes sure that they are aware of them. Like that disclosure and upfront kind of education of the consumer of what their rights are under this bill and under our policies is part of it. So they should know that this is their right, and if it's being violated, that they do have a course of action. And that is articulated in the bill in addition to the consent piece. And again, I don't think I need to recap what the bill does. The senator did a good job doing that. And actually, Richie kind of addressed my testimony on the amendments. But again, we're working very closely to make sure the bill is properly tailored to the right entities. And I think that we're pretty close to finding a path forward that'll suit all the parties. So again, I urge a favorable report and welcome any questions. So thank you.
Now, the prior speaker indicated you're working with the AG, but you aren't sure you're going to get there.
So I think, post the House hearing, we kind of received comments on potential amendments from both the Consumer Protection Division of the Attorney General's office and from pharma. And pharma's concerns primarily, and they may have a letter in your packet, kind of were on what entities would be included in the bill and who it would apply to. So I think in clarifying that definition, that would allow us to accept the Attorney General or the Consumer Protection Division's amendments relating to the exemption for higher education institutions. There was another clarifying amendment on the definition of genetic data. That is fine. And the inclusion of disability insurance is one of the kind of consent pieces. And those are all fine. And I think we're very close. We're hopefully close in working out this de-identification issue. We've had similar discussions on other bills as well. I would note, Madam Chair, just also in answering your question, this bill, while it is not the same as some of the larger privacy bills that are moving through, is interoperable with the bills that have passed in other states and in Virginia and things like that. It can work in conjunction with them, but it is not exactly the same. Yes.
Okay. Hannah Abrams. Oh, Senator Benson, did you have a?
I just want to ask a question. Thank you, Madam Chair. The course of action, is that spelled out in the contract?
So it's not in the, I don't speak to the bill would make a violation of this act it's a violation of the Consumer Protection Act, which is an existing state law. Yeah, unfair trade practice and
Unfair deceptive trade
so the penalties that are in place under that existing law would apply if this were to be violated.
The concern that I have is that the consumer needs to know that there is a course of action.
Mm-hmm.
Well,
So
the
you're
next-
saying that it is spelled, it's written in such a way that it's clear to the consumer.
Yeah, and that's a big element of the bill, because I mean, what we didn't want is, oh, you have these rights, but we've buried them in terms of service, and you don't really know when they're happening or not. So a big aspect of this bill, and I don't think it should be overlooked, is that disclosure and upfront attention to the consumer, so they know what's happening up front, and the systematic consent for kind of every piece along the way.
Thank you very much. This is a very important bill.
Thank you,
Okay.
Senator.
The next witness is from the Office of the Attorney General, so let's hear from you.
Madam Chair, committee members, my name is Hannah Abrams, and I'm an Assistant Attorney General in the Consumer Protection Division of the AG's office, here to speak in support of Senate Bill 766 with amendments. Thank you for listening to me today. The Consumer Protection Division strongly supports providing consumers with rights and protections in connection with their genetic data. However, the bill as drafted raises serious concerns, and we have offered amendment in the written testimony we submitted to address these issues. We appreciate hearing that they are considering them. The first is the carve-out for educational institutions, and that carve-out is extremely broad, whether the institution is public, private, nonprofit, or for-profit, as well as any entity owned or operated by these institutions. First, one of the hallmarks of for-profit educational institutions is that they do not conduct research, and so there's really no reason to exclude them from the coverage here. Second, most of the health-related research conducted by academic institutions is covered by other federal regulations that we could, and so there's no reason to carve those out. We also recommend removing or further limiting the exemption for de-identified data. De-identified data sounds good because it sounds like there is no way to connect it to a person. This is a misnomer. It should be clear that de-identified data can be re-identified. Study after study has demonstrated this. The American Medical Association's latest Board of Trustees report explicitly stated that in terms of privacy, increasingly, it has been recognized that genetic data cannot be de-identified. A DNA profile alone may be adequate to identify most individuals, even in the absence of other identifying information, including individuals that have not previously participated in genetic testing. To the extent the committee chooses to permit this exemption, they should recognize that it is not truly anonymous. And we understand also that there have been a number of amendments proposed by the pharmaceutical industry to exempt genetic information collected in the context of research and to effectively eliminate the requirement for contractual controls prohibiting re-identification. We oppose these amendments. SB 766 governs genetic information collected by direct-to-consumer genetic testing companies. These entities claim they are not healthcare providers and therefore are not governed by HIPAA and other federal regulations. Because of the advances in technology and the ways that data can be re-identified, the NIH even, and other research institutions, has emphasized that de-identification practices should include contractual controls, such as those required by SB 766. The Pharma Amendment would negate this the necessary requirement and make the protections and weaken the protections to de-identified data. These issues are complicated, and I'm happy to answer any questions, but we urge a favorable report with these amendments. Thank you.
Thank you. Are there any questions? Okay. Now, I do see a letter from your office indicating what the amendments, a description of them.
Exactly.
But have the actual amendments been worked out?
We haven't seen the amendments as proposed by the sponsor, but we heard that they are coming.
Because I think that they would be very helpful in the description, yeah.
Just on some of these amendments, we're talking about the for-profit education or, pharma. The other three states you referenced, do those have, how do they handle these two kind of
So
interesting
in the
issues?
other states, they do have this exemption for higher education institutions. And in talking with the Attorney General's office, I think part of the issue there is how Maryland in the education article defines institution of higher education. It may be broader than those states. So while this language matches, I can't speak to whether that definition in the education
What about
article.
the research pharma issue?
So what we're trying to do, and again, since the House hearing, we've been in like constant discussions, is if we clarify the general scope of the bill a little better to make sure this is applying to direct-to-consumer genetic testing entities, then we don't feel that we need those exemptions as much, because then it will be clear that you're kind of engaging in the activities that should be governed by the bill. If you're doing research either that's already governed by a federal law, as Hannah alluded to, or is kind of outside the scope of the bill, we can do that in that definition, and then we may not need some of the other
Okay,
definitions.
that's helpful. I mean, I could see how this could be crafted to
Yeah,
be more
and I don't
targeted.
know if we should.
But anyway, thank you, Madam Chair.
Yeah, it occurs to me, though, that many grown-ups with even college degrees are ignorant of the implications of some of the stuff they're willing to sign off on, and they don't understand what they're doing. So, Mr. Sponsor, I would prefer not to see us
No,
give anybody an easy lift.
no problem. Like I said, we have been working on some of the amendments after I had received
Okay.
this.
All right, thank you. Any other questions? Thanks so much. That ends the testimony on that.
Thank you.
bill. Okay. All right, we're going next to you, Senator Kramer. Senate Bill 825, Consumer Credit Commercial Financing Transactions. And let's see your panel, Kelly Locklear, Avesta Sakash, and Claudia Tolles.
All right, good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. It's time to wake up and focus on an outstanding bill that is good for our small businesses in the state of Maryland. Committee, it'll be a bill that is familiar to you all, and I'm going to circle back about the history of the bill and the opposition to it in the past, and there's considerably less opposition this year because this work product reflects a tremendous amount of effort to find compromise, and at the end of the day is a bill that is identical, and I will challenge the opposition to come up if they believe it is not identical to legislation that has passed in the great state of New York, which also is almost, if not identical, to what has been passed in California. So what the bill you have this year tracks exactly what has been done elsewhere, and I will explain the logic to that as well. Senate Bill 825 provides common sense regulations for the commercial financing industry. This is an industry that has sprung up over the past couple of decades, unregulated and largely unnoticed until recent years. This is an industry that provides financing to small businesses, mom and pop businesses. I said they're unregulated because these entities have designed their business model and lending practices to skirt existing lending laws, both state and federal. There are some good actors within this space, but colleagues, there are far too many that are extremely predatory in their lending practices. They make cold calls with aggressive sales tactics and offer misleading information in an effort to lure small business owners into accepting deals that are too good to be true, and that's because they are too good to be true. They are the payday loans, and I'm going to emphasize that. They are the payday loans of mom and pop businesses, loans that we have banned for consumers in Maryland. These loans typically include extremely high, excessive interest rates, unprecedented and mainstream commercial lending, and allow the lenders to seize the assets of the small business owner with little or no notice. The Federal Reserve has conducted a study on these types of lenders and has raised significant red flags about the frightening and dangerous practices of this industry. Bloomberg did an extensive investigation into the industry and their practices, their abusive, predatory practices, and again, too, raised significant concerns about the way this industry preys on small mom and pop businesses. Colleagues, it's unfortunate that we did not address these payday lenders before the pandemic. As a consequence, during the course of the pandemic, many small mom and pop businesses, desperate for financing, have now found themselves ripped off in unprecedented numbers. This is the year that we must address this Wild West unregulated industry. So what does the bill do? As I stated to begin with, it is modeled exactly after what New York has done and California as well. It defines the types of commercial financing that are covered. It clarifies what types of financing and entities are not covered by the bill. And it also excludes transactions over $2.5 million. The point here being, we're not looking to protect Martin Marietta or IBM. We're looking to protect our small mom and pop businesses here in the state. It requires that the lender disclose the annual percentage rate and allows the lender to do that utilizing one of two different models, just like in California and New York. So colleagues, if the opposition has the nerve to sit down at this table and tell you they don't know how to do that, well, if their industry's practicing in California and New York, they know exactly how to do it, and the bill specifies how it's to be done. The bill requires that all fees and extra charges that are being added to the interest be disclosed. The bill requires an acknowledgement that the borrower has been provided the disclosure information. And finally, the bill provides that the Commissioner of Financial Regulation shall adopt regulations substantially similar to those of New York to implement the bill. There are a few amendments, one of which is a technical amendment that the committee has already received. There will be an amendment to define the traditional bankers as opposed to the definition that is used now. Mr. Enton, representing them, will provide me with that amendment to ensure that we are not mistakenly pulling in the traditional commercial lenders who are already heavily regulated in their activities. There is an amendment that will ensure that entities that purchase the liens of physicians on patient debt are not mistakenly pulled into this bill, because that's not the intent. And finally, the Attorney General's office has asked for 2 amendments, one of which is very easy. They don't want to be bothered with the enforcement provisions of this bill, and that's fine. The Commissioner of Financial Regulations will be the enforcement agency, and we will clarify that. I don't think we pulled the AG's office in, but they're concerned that we have, so we'll clarify it. The other part that I'm hoping to work out with their office is that the bill has the definition of how we get to what is a commercial loan under the bill, the identical language used in California and New York, but the Attorney General is afraid it may create some spillover into consumer lending, which I'm a little bit confused by, but my good friend Steve Sakamoto Wengel is here. I believe he'll come up to speak on the matter, and he and I have been talking about addressing it. So real fast, colleagues, where has this bill gone since it was first introduced 2 years ago? Colleagues, 2 years ago, the bill came in as a prohibition on this kind of lending, a total ban, because of the predatory nature and the fact that it is payday loans for small business owners. The industry came up in opposition and said, no, don't ban us. Don't ban us, regulate us. Regulate our industry, but don't ban us. So last year, the bill came in as a regulatory process. Regulate the industry. But then the industry said, no, but the regulations include a cap on the exorbitant interest that we can charge these mom and pop industries. We don't want to have a cap on that. We want to be able to rip them off for all we're worth. So we heard that. New York and California, to date, have not implemented a cap on the exorbitant interest. And since this bill mimics what New York and California have done, we don't have a cap on the interest rates this year, colleagues. The industry also came in last year and said, okay, if you're going to regulate, we don't want a patchwork of bills. It can't be Maryland does one thing and other states do other things. We heard that. That's why the bill now is reflective of what California and New York have done. No patchwork. If they do business in New York, if they do business in California, then there is nothing in this bill that prohibits them from doing their thing here in Maryland, because they have to comply with those regulations and they'll comply with ours. So here we are now. We have heard what the industry has had to say. They didn't want a patchwork. They don't have one. They didn't want caps. They don't have them. They wanted to be regulated instead of prohibited. That's the bill before you. So with that, colleagues, I hope that this is the last year we need to take up this issue and that we pass the bill and we address the concerns of the small business mom and pop owners in our state and protect them from being preyed upon by those who are doing so right now. I ask for a favorable report. Thank you, Madam Chair.
Thank you. Senator Augustine?
Thank you, Madam Chair. Senator, there's a letter from the Department of Labor that I want to give you the opportunity to respond to, where they suggest that this is going to create a complicated system of disclosures and reporting, like you said, similar to what is being contemplated in New York. Then they suggest, though, that it actually has not yet been implemented in New York, and that because it tries to follow the way it's set up in New York, that it might create some problems if New York were to change their, how they intend to enact or procedures. How do you reconcile that with what you just testified to?
Excellent question. Thank you for that, Senator Augustine. It is reflected in the bill itself. First of all, New York is ready to promulgate their regulations, and what is in this bill is exceedingly unlikely to change from anything they tweak going forward. But to ensure we cover that very aspect, the bill specifies that to carry out this subtitle, the commissioner, and by the way, we have been working with the Office of the Commissioner on this legislation very closely to ensure that they were familiar with what we were doing, that they understood what we were doing, and that they were okay with what we have in this bill because it's going to go to them. But the bill specifies the commissioner shall adopt regulations substantially the same as regulations adopted by the New York State Department of Financial Services regarding commercial financing, anticipating that New York may end up tweaking some of what it is that's before us. And now, because of that, we've assigned to the commissioner the responsibility of tying the final product here to that comes from New York. Again, to ensure we don't have a patchwork, which is what the industry had been complaining about. So New York and California have been working very closely on what is here, and now we're going to ensure that what's here tracks that work product. So thank you for that question, but that is why that provision was put in. And thank you.
All right. If no other questions, let's go to the panel. Kaylee, you guys have 2 minutes each.
Good afternoon, Madam Chair and honorable members of the committee. For the record, Kaylee Locklear here on behalf of the Maryland Retailers Association in strong support of this legislation. So I think what is very important to understand is that these commercial lenders who will come up behind me, who continue to stand in opposition, are intentionally doing anything and everything they can to not be regulated in any form here in Maryland, including going as far as now to offer weak or even what I would categorize as fake bills in other states to pretend like they are going to create transparency moving forward. But now that California as well as New York have moved these laws, and these lenders still operate in those states, there is no valid argument to block the basic transparency that is outlined in this bill. Businesses have been suckered in for far too long, completely unclear about what they are getting themselves into, and what appears to be a quick and easy loan. But the reality can be in upwards of 200, 300, 400% in interest, with massive upfront hidden fees and high default rates. We've also shared with your offices a handful of articles I hope you will take a look at that have been published nationally, from the Washington Post to Forbes magazine, discussing small businesses who desperately just need transparency with regard to these loan products. Just like payday lending, and Maryland was ahead of its time in addressing that issue, predatory commercial lending is impacting and taking down small businesses in your districts, and this bill is a small step in a direction of helping them. Thank you, and I'm glad to answer any questions.
Thank you. Senator Augustine? Okay. Okay, then let's go to Abesta Sarkash.
Thank you so much. Thank you, Madam Chair and members of the committee. My name is Awesta Sarkash, and I'm the Government Affairs Director for Small Business Majority, a national small business organization that empowers America's diverse entrepreneurs.
Thank you for the opportunity to discuss Senate Bill 825, which would enact critical protections for small business borrowers. This legislation is vital because it would ensure safeguards to protect small businesses in Maryland from unclear and opaque loan terms, allowing them to make apples-to-apples comparisons when searching for capital. As mentioned before, the bill is applicable to financing products below $2.5 million because it is those smaller Main Street businesses that are often being misled by the lack of transparency today. The legislation is needed because small businesses in Maryland could unknowingly agree to high-cost loan terms that lenders can legally offer through opaque terms and deceptive practices. This is a common reality for small businesses. They sometimes realize, often too late, that their actual percentage rate or APR is in fact in the triple digits. The Federal Reserve found in at least 4 studies that small businesses are misled into accepting higher cost financing products by pricing metrics commonly used today. In fact, that research indicated that minority-owned firms more frequently applied for potential higher cost and less transparent credit products, specifically merchant cash advance and factoring products. This practice reinforces existing access to capital disparities and diminishes entrepreneurship. Small businesses recognize the need for this type of protection, which is why 75% of them support this type of legislation. Despite what you might hear today, this bill will not outlaw any products or restrict access to capital in any way. Simply requiring price transparency for Maryland small businesses is a benefit to the small business ecosystem. You're probably also going to hear from companies that offer merchant cash advances that they can't estimate APR and disclose it. And as you've heard already, they're going to be required to do something similar in both California and New York. They should do the same for Maryland small businesses. I ask that you vote in favor of this legislation. Ask yourself why we're protecting individuals and not small businesses. Please pass this.
Thank you. All right, then we'll go next to Claudia Tells.
Thank you, Madam Chair and members of the committee. My name is Claudia Tolles. I owned a small business, a toy store in Fells Point for over 20 years. We closed in October of last year. I'm here in support of House Bill 825, which provides much-needed transparency in commercial lending. Without accountability by the state, small businesses across Maryland, including my own, are open to being targeted and misled as to the true cost of financing in this unregulated commercial financing space. Predatory lenders, such as merchant cash advance lenders and online lenders, often deceive and coerce buyers into unfair, abusive terms, according to the U.S. Small Business Administration. That is a quote from December 21st, 2020, which was unfortunately already too late for many small businesses, as pointed out by the Senator. Merchant financing and unregulated commercial financing products addressed in House Bill 825 oftentimes come with predatory practices such as cold calling merchants incessantly on personal lines that are accessible through business records, in addition to flashy marketing, which misleads businesses into believing that this type of loan is actually something that is sustainable and that can actually be serviced by the small businesses' merchant capital. When small businesses are making decisions, choosing a financial tool that they should be allowed to understand, important, clear disclosures are not in our current operating system with regards to these lenders. There has been such opposition in the past because they feel that it may be unmarketable if they have to communicate the actual terms. And I would say, why would we insist on choice in other areas like health that I heard before and not with small businesses? Because it's the small businesses, mom and pops, who don't have the resources to outsource to an attorney or to a financial advisor to make these decisions, which are presented with complicated information. I urge you to pass this bill.
Thank you. Yes, Senator.
Yeah, well, just for Senator Kramer, you know, I think, again, you don't get the rebuttal here, so just, I think what you're going to hear is you want to align with New York and California, and yet there's still, Senator Augustine mentioned New York, but it looks like California is still having multiple rounds in terms of their regs aren't even finalized yet. So if the goal here is to align with New York, California, and they're still unsettled on some of the minutia of their regs, why would we not wait until those are ironed out before we come in? You know, the bill is effective October 1 of 2022, and those two states are still grappling. So how would you respond to that? Because I think that's what we're going to hear. So I'd like to hear you on the front end.
And thank you for that question. And so, yes, the opposition is going to be grasping at anything at this point, and I have no doubt they will focus on, and as you said, the minutia is what has not been finalized. So New York is on the precipice of getting it finalized. We're not quite sure California is there, but again, New York and California have worked very closely to align what they are doing in the way of their regulations. New York appears to be, again, poised to do so any month now, and that's why we tied the bill specifically to New York to ensure that it'll track exactly what they are doing. And quite frankly, I would be very comfortable with an amendment that states these regulations will go into effect simultaneously with those when they go into effect in New York. And that'll erase any doubt that if by October 1st, if somehow New York hasn't finalized their regs, then we're not committed to do so either. But if they have, then by all means, as soon as New York's regs go into effect, because for those who have been working very closely with both California, New York, and those of us here are intimately familiar with what's happening there, and their point is it could be happening any day, week, very likely not much longer than a couple of months in New York, which is why we also provided that additional language in case something gets tweaked beyond this bill, that our financial commissioner will make the same adjustments to follow what New York has done and eliminate all of the complaints about this notion of patchwork legislation. So, but I would be happy to adopt such an amendment that ties it directly to the date of adoption in New York.
Okay.
And thank you for that question.
Can I also add something, Senator?
Sure.
I just wanted to also add, it seems like the legislation has had a long history in the state, and I just think the importance of passing it now is really critical. If we had passed this some odd years ago, the small businesses who had to search for capital during the pandemic, who dealt with predatory lending practices, would have been protected during the worst time of their, for their small business, as was discussed here. I think ultimately we shouldn't let perfection get in the way of progress. How many more small businesses will close without this type of protection?
Okay, thank you.
Thank you.
All right, we're going to move next to the favorable, well, no, we got one more. Robert Enton, are you favorable with amendment or favorable? Where's Bob?
Bob may have had to leave to go testify on a
Okay,
bill
all
in the
right.
House.
But let's go then to the four that are favorable with
But
amendment.
had he been here, he would have told you he was.
Okay, Lorenzo Bellamy, Chris DePietro, Leah Maltby, and Chris Grimm. These are favorables with amendment. We have 2 minutes each.
1 minute and 57 seconds. Good afternoon, Madam Chair, Vice Chairman Feldman, members of the committee. Lorenzo Bellamy on behalf of Americans Patients for Access. In support of Senate Bill 825 with amendment. Initially, we were coming to this table in opposition to this bill, but after having very favorable conversations with the bill sponsor, Senator Kramer, who accepted our amendment that essentially provides a exemption for the type of business that we do. I have with me Ms. Lee Maltby, who is the Associate Director for Americans for Patient Access, who's going to talk a little bit more about the amendment and why we need it in order to exempt us and for us to come to the table favorable with amendments. But before she does talk, I just wanted to tell you briefly about the association. Americans for Patients Americans for Patient Access is a national nonprofit trade organization that supports innovative medical lien solution programs that provide physicians with financial capital they need to provide lien-based care to personal injury patients while waiting for the final resolution of the personal injury case. Our membership consists of physicians and specialty finance companies that factor medical receivables owed to a healthcare provider by an injured person. Essentially, we purchase the account receivables owed by a patient to a medical provider. So with that, I would like to turn it over to Ms. Maltby to talk a little bit about the amendment that Senator Kramer has offered, and we urge a favorable report with amendment. Thank you.
All right. You can pull it even closer if you like. It's pretty movable. Okay.
Thank you, Madam Chairwoman, Vice Chair Feldman, and Senator Kramer for taking the time to speak with us yesterday and your willingness to accept our amendment as friendly. Again, my name is Lee Maltby, and I am the Associate Director for Americans for Patient Access. The APA works to provide immediate access to necessary and quality health care for uninsured and underinsured patients who have been injured through no fault of their own, and to aid medical providers in offering their services to as many patients as possible, regardless of that patient's ability to pay. We are a financial solution to medical providers that want to treat personal injury patients, but cannot wait an average of 2 to 4 years to get paid, if at all, from the underlying legal claim. By factoring those receivables, physicians get immediate, prompt, guaranteed payment and can keep their doors open to personal injury patients. We believe that, as written without the amendment, the definitions of commercial financing, including factoring, and provider, as one who engages in commercial financing, clearly implicate how we operate. We do not believe that medical factoring was the target of this bill, as the Senator said, and that without this amendment, it will be impossible for our members to comply with the disclosure requirements. For example, our factoring transaction is an outright sale and purchase, so the concept of APR in the bill does not apply to our business model. There is no APR, it is just sale price and payment price. Our members want to be compliant providers of commercial financing in the state of Maryland, but the disclosure requirements of Senate Bill 825 would create confusion for our medical providers and complicate our agreements. We are in favor of transparency, and we want to continue to do business with the medical providers and patients in Maryland. We request that this amendment be adopted and that Senate Bill 825 move forward with the amendment. Thank you for your time today.
Thank you. I have a question.
Yes,
Does
ma'am.
the Office of Financial Regulation already regulate the business model that you guys have? And if not, who would be the regulator in Maryland?
That is actually a very good question, ma'am, and I would need to double check on that, and I would be happy to get back to you.
Okay. All right. Okay, let's move on to who'd like to go next.
Madam Chair, Mr. Vice Chair, members of the committee, my name is Chris Grimm, and I represent the Innovative Lending Platform Association. Thank you for the opportunity to testify in support of Senate Bill 825. Thank you to Senator Kramer for introducing this important bill and to the Maryland retailers and the other stakeholders that are supporting this bill. This is the third time that we've testified on this issue in this committee, and we're very happy to be testifying in support this year. The Innovative Lending Platform Association, ILPA, is a leading trade organization for online small business finance providers and servicers. Our members are proud to provide thousands of Maryland businesses with working capital to invest in their business, purchase inventory, hire extra hands for the busy season, expand their business, or repair damaged or outdated equipment. Our members use innovative underwriting and the latest technology to quickly evaluate a customer's credit risk and provide financing in as little as 24 hours. ILPA is dedicated to advancing best practices and standards that promote responsible innovation and access to capital. ILPA strongly supports transparency and disclosures. In 2016, ILPA created the industry-first model disclosure tool, the Smart Box, that presents small business borrowers with comprehensive pricing metrics and identifies key loan terms in plain, easy-to-understand language. We believe small businesses are empowered when presented with easy-to-understand metrics and can compare costs, term, and other critical metrics across different providers and products. This is why we support this bill and why we supported the bill that passed in New York that this bill is based on and was referenced earlier significantly. Our amendment is very, very straightforward. As more states are following New York's lead, we're requesting for language be added that the commissioner approve disclosure forms that are approved in other states if those states' requirements meet or exceed Maryland's, so that this would be a floor just to ease compliance burdens across states if there are some differences. Again, you wouldn't be able to use a form that has fewer requirements, only more, just in case that does happen. So that's our one amendment. Otherwise, we're very strong supporters of this bill and request a favorable report.
Okay. Before I call on Chris DePietro, let me go back and just ask my question a different way. Who in Maryland or elsewhere at a federal level is the regulator for the book of business that you do right now? It sounds like a good business. I'm trying to figure, you got to be regulated by somebody.
So there's some overlapping regulations, and it depends on the business model. Some providers work with federally or state chartered banks, and they're just a partner that connects the recipient with those banks. So the bank is the lender, and they are the ones that are regulated in the state that they're chartered in or federally. Other providers have different business models, and they're lending directly. And many states have separate regulations for consumer and commercial financing. In most part, there are no regulations on commercial financing. So New York and California were really the first states to bring a regulatory regime to this industry.
Okay. All right. Yeah, Senator Kramer.
I wanted to clarify that, Madam Chair, so that you're clear on this. And the point is, this is an entity that currently is not regulated. And that's why we are here right now, because we're lacking those federal and state regulations. And the reason you're here this year in support is because we've worked with the industry to address their concerns and have reached this compromise on where we are that is reflected by the work in New York. Is that accurate?
Yes.
Thank you. Thank you, Madam
I think
Chair.
you've done a good job of showing me what's wrong with what's going on that needs to be corrected. I'm just trying to find out with regard to you guys, who, given your business model, is the regulator.
But they're not. That's the whole point. There is no regulator at the moment, which is why we have the legislation before us. If they were regulated, we wouldn't have this
So
problem.
in other words, you're doing the same business we're talking about, but nobody's regulating you, but you're good guys doing it, and you're trying to keep out these bad
The
guys.
bad guys,
I see.
precisely.
I see.
Correct. Yes, ma'am.
I see. Okay, that's helpful. All right, let's go to Chris DePietro.
Madam Chair, members of the committee, Chris DePietro here on behalf of Fiserv. I would like to quickly try to expand on that answer just a little bit before I go into my testimony. I think this particular product is not regulated, but like the business, like my client is certainly regulated by the commissioner's office. It just depends on what the business lines that they're involved with. I know we are regulated by GLBA and FCRA, depending on the products and services that we're providing. So I don't want to give the impression that we're.
The product, not your
Yeah, let's be specific
entire
about the
business.
product, right,
Okay.
exactly, and not globally unregulated
Okay.
because we are regulated as a company. So again, Chris DePietro on behalf of Fiserv. Fiserv is a global financial services company. You probably are aware of us. You probably interacted with our clients if you've gone to a merchant and used a Clover terminal. If you've seen those in stores and small businesses all across the state and the country, you are interacting with our clients. We do offer the sales-based financing transactions, and correct, with the senator stated before, we have big concerns with the bills in its prior iterations for the last 2 years. But the senator listened, because we, in our testimony last year, said if you model what you're trying to do here in Maryland off of the New York statute that was well underway at the time, and I do think those regulations are very close to being finalized. It's not like it's an unknown what these regulations are going to look like. I think my client has a pretty good idea of where it's heading, and I think we can comply with those. And that's why we're here today to support the bill, because we agree that the way to go forward, especially with a company like ours that operates nationally and internationally, we want to make sure we have a consistent framework in which to do business.
Let me ask you this.
Yes.
Since we've got a representative from AG's office sitting right here, would you care if we asked them to check with the folks in New York as to how it's coming from the perspective of comparable regulators in New York?
Yeah, no, I don't think we have a position on that.
Because you're really asking us to buy a pig in the poke. It sounds good.
Right.
But if it isn't all the way through as regulations,
I'll let Mr. Sakamoto Wengel speak for himself. Obviously,
Okay.
he's going to represent the AG's office and their point of view on this, but I don't think we are comfortable being regulated by the Commissioner of Financial Regulation. We have licensing with that office now. We're used to that office. We can work with that office.
Okay.
So we're here in support of the bill. There was a technical amendment
Okay.
that we offered to the senator. He agreed to sponsor that and put that in, that he referenced in his testimony.
Okay, back to the sponsor. You have a.
Yeah,
Right.
just real fast, Chris, so that we've got clarity.
Yes.
Your client
Yes.
has acknowledged that the New York regulations, they're on the cusp.
They're on the cusp.
And the company you're representing
Yes.
supports those regulations, and this bill is a reflection of what is right there on the cusp of New York, and that there may be some tweaks, and this bill accounts for those tweaks by giving the commissioner, or ensuring the commissioner, have regs that reflect what New York has
Well,
done.
I think the way the bill is drafted gives that latitude to the commissioner to make sure that they're substantially similar to what is being done in New York. Obviously, the Maryland commissioner will have to promulgate regulations and go through that process. Usually, this commissioner is very good about engaging with industry ahead of the proposal of regulations to make sure that they're in a good form, because we want to move forward and not have a process that's bogged down in a lot of opposition. So we respect that approach, and I think this commissioner will do the same thing.
Okay, great, thank you.
Okay, all right, that's helpful. Okay. So I think we heard from everybody on this panel. All right, we're going to the last panel of unfavorables, Frank Boston, Catlin McDonough, and Patrick Siegfried. You have 2 minutes each.
Okay, good afternoon, Madam Chair and members of the committee. I'm Frank Boston III. I am here today on behalf of the Revenue-Based Finance Coalition and the Small Business Finance Association, and we respectfully oppose. So I do want to start off by thanking and applauding Senator Kramer. What he said to you is absolutely true. There was a ban bill, we opposed that. And then he came in and we worked with them, and the bill before you today took the cap out. That was one of the big things we wanted, and he worked with us to amend this. And that was huge, so thank you, Senator. But the disclosure on the APR is still problematic, and that's why we're here today to oppose the bill. My clients support disclosure, but this legislation is too complicated and will result in inaccurate disclosures that will confuse small business owners and limit access to capital for small businesses. The main problem here is the APR disclosure. APR has never applied to commercial finance products. California passed the disclosure bill in August of 2018, and the regulator still has not implemented the law or adopted APR. In New York, the primary financial regulator was opposed to including APR as a disclosure. The Federal Reserve Board concluded after a review of APR that, quote, and I quote this, most consumers do not understand the effective APR, and that for some consumers, the effective APR is confusing and detracts from the effectiveness of other disclosures. End of quote. And the quote for that is 74 Federal Reg 5244. But I'm out of time.
Okay. If you
I
could-
did
if you
want to
could
mention one.
Send that to me in writing, just send me
Yep,
an
I just
email.
want to mention one last thing. Virginia and Utah did pass laws in this space, and in those states, there's no APR disclosure.
Okay,
And I have the bill numbers if you want those.
okay, that would all be helpful.
Yep.
All right, let's go to the next person.
All right. Chairman Kelly and members of this committee, my name is Patrick Siegfried.
Pull that a little closer to you.
I'm here on behalf of Rapid Financial Services. Founded in 2006, Rapid is headquartered in Montgomery County, Maryland. Rapid is a proud supporter and finance provider to small businesses nationwide. Rapid believes legislation impacting commercial finance should be tailored to the needs and the use cases of the small business customers that utilize these products. Multiple states, including Maryland, are discussing legislation that would require disclosures for certain commercial finance transactions. As Frank mentioned, California was one of the first states to pass such commercial finance laws in 2018. However, over the past 4 years, California's regulator has conducted multiple rounds of notice and comment periods for its draft regulations. We expect California to finalize these regulations later this year. Similarly, New York passed commercial finance disclosure legislation in 2021, and while New York recently proposed its own draft regulations, it's currently planning a more in-depth comment and review period and has paused the implementation of the New York law. And just 2 days ago, the Virginia's legislature passed a comprehensive commercial finance disclosure law for which Rapid and the SBFA were supportive. While Rapid is supportive of effective disclosure legislation, we would just urge this committee to work towards passing a bill that will not conflict with the efforts of these other states. Enacting differing disclosure requirements will lead to confusion among small business customers. And I think it's important to note that there's differences between California regulations and New York regulations. And as Frank rightfully noted, there's considerable concern on behalf of the New York regulator as to the regulations that have been promulgated from California, hence the pause on implementation of the law. While we oppose 825, we're committed to working with this committee as well as the sponsor, and we do thank him for his iterations of this bill. I believe we are very close to getting something that will work for all parties involved, but I would just urge us to have a little bit more time. Let's see where the regulations and laws shake out in these other states, and then let's move forward here in Maryland.
So what was passed a couple of days ago in Virginia was the APR disclosed?
Without APR, again, it was initially proposed with APR. We highlighted the issues and difficulty of calculating an APR for commercial finance products, and the sponsor of that legislation worked with us, and it is now.
If somebody could send us a copy of that.
Absolutely.
That would be helpful.
Yeah, for the record, it's House Bill 1027.
But we'll
Okay.
get it to you, Madam Chair.
Yeah, we'll get it to you.
Okay, thank you. All right. And now we didn't hear from you yet.
Yeah, and good afternoon, committee, Madam Chair, and members of the committee. Caitlin McDonough on behalf of Rapid Financial Services, Rapid Finance. And I won't repeat the previous testimony, but again, the bill has gotten better every year as far as we've been working with it. And I think, we struggled over coming in opposition or favorable with amendment, but the language around APR is something that is a key concern for us. So we did ultimately decide on opposition as drafted, always open to working with the sponsor and the committee on this. And we continue to work on these same issues in other states as they work toward ultimate implementation of the bill. Just kind of because there was, I think, some question about it, about how we would be complying in other states and not necessarily in Maryland where this bill to pass is, we're not, because that they haven't been implemented yet. So just to kind of rectify those two questions. But, we're working. So thank
Okay.
you, committee.
Thank you.
Yep, thank you.
Bob Anton, normally I wouldn't ask you to do anything since you weren't here, but I was told you were testifying in another committee. Do you want to take 1 minute and just give us your take on Senate Bill 825?
You on the opposition panel.
Madam Chairman, members of the committee, Robert Enton on behalf of the Maryland Bankers. I was testifying on one of my favorite bills, the state bank bill in the House Economic Matters Committee. And just let me say, Maryland Bankers fully supports Senator Kramer's bill. We think, this is the third year that the bill has been in. We've supported it every year. There's language that deals with financial institutions, which I think is from New York. I think we'd have a technical amendment to that. We prefer the definition from the last 2 years, which is more tuned to Maryland law. But other than that, all I would say is we're in full support of the bill. We think that we can't continue not to have these entities subject to regulation. Thank you.
Okay, and everybody has said that the APR is not being disclosed, and that's what we were discussing when you came in, whether it should be or not.
Yeah, well, look, in every loan document that I see, it's disclosed, and this is a loan. You can call it a cash advance, but it's a loan.
It is. Okay, all right.
Stay where you are,
Okay, thank you.
I'm not seeking a Graham Leach Bliley
Did you want to
exemption.
say something there?
Oh, I've got questions for the panel, Madam Chair, so
All right,
yes,
well-
thank you. And it'll be for Mr. Siegfried, but I just want to clarify with Mr. Enton sitting there at the table, that with every loan that your members make, there is an annual percentage rate that is provided to the borrower so they know what interest they're paying. Is that correct?
Yes, sir.
In every instance?
As far as I know, it's on your credit card, it's your car loan, it's your mortgage.
Perfect. So, Mr. Siegfried, would you concede that in the New York regulations, as they exist right now, there is a formula, in fact, two formulas, for determining what the annual percentage rate is on the kind of financing that your business does? Is that fact or not?
That is incorrect, Senator. The two formulas you're talking about is how to come up with the estimated revenue of the business that has received the financing. The calculation is actually pursuant to TILA, and while I'd just like to highlight, TILA does not apply to business or commercial financing, and while there are banks who voluntarily do that, TILA does not require commercial financing.
Not my question, sir. You're getting far afield. The requirements in this bill to provide an annual percentage rate, are you saying they are different from or non-existent in the New York state law?
There is a calculation of the APR.
That's
but it
correct. That's what I'm asking you,
It
sir.
references TILA. They're not, the two particular formulas you're talking about are not to calculate the APR. And again, this is an area where the New York regulator is concerned
Mr.
about.
Siegfried, you can try to avoid answering the question and dance as best as you can, because I hear the shoes tapping. But I am asking you a specific question. In this bill, there is a requirement that defines what the APR is. Is that or is that not in the New York bill?
It is the same calculation.
It is in the New York bill. Thank you, Mr. Siegfried. I know
Okay.
you tried to dance around answering the
Okay.
question, but thank you, because, and next question, thank you, Madam Chair. If New York adopts their regulations, is your industry going to continue to do business in New York?
It will remain to be seen in terms of the impact to the smaller finance providers who may not be in a position to undergo the complicated calculations to come up with an APR, especially when there's assumptions that have to be made.
The complicated computations that are spelled out verbatim in this bill. Thank you, Mr. Siegfried.
Unfortunately, that's not the case because, again, that references TILA, and there's regulations that have been promulgated for TILA do not exist in that bill.
You're still trying to dance, sir, but you answered the question, and I thank you and I appreciate
And
it.
again, thank you, Senator, for making
All
the
right.
changes over the
Thank
course
you,
of the last few
And that
years.
ends the testimony on this bill. Thank you. All right, we're going next to Senator Wallstreicher, Senate Bill 880, Safe Access for All Roads Act of 2022. And let's see, let me call up Jan Brock Cancelleri, John Becker, and Franz Snyderman.
Good to see you. Dancing.
Okay.
Thank you, Madam Chair, Mr. Vice Chairman, members of the committee. Senate Bill 880 is styled the Safe Roads Act of 2022, and it does exactly that. Since the beginning of the pandemic, we've seen a rash of road deaths. At first, I thought it was due to speeding on the empty roads. Of course, that hasn't been the case for a long time, and yet road deaths continue to climb. What's the solution? It takes a comprehensive, multi-pronged approach. In order to protect pedestrians, bicyclists, and drivers, this legislation does 6 things. First, it requires context-driven design. State Highway for decades only sought to increase car throughput. In recent years, they have rightly decided to change to context-driven design, taking into consideration other road users and the specific needs of urban areas. This bill memorializes that evolution. Second, the SHA shall conduct analyses of corridors with significant fatalities. For example, in JPR, we hear frequently of the dangers of Indian Head Highway in Prince George's County. This would require a study of such a corridor. Third, after study, it requires SHA to recommend changes to those dangerous corridors and then, in fact, to make those changes. Fourth, if those changes are substantial and long-term, it requires SHA to make temporary, inexpensive, short-term improvements. For example, if a curb is being bumped out over the long term to narrow a dangerous intersection, plastic flex posts could be used temporarily to mimic that bump out until construction begins. Fifth, it mandates appropriations for ADA compliance, bicycle safety improvements, driver safety improvements, sidewalks, and traffic management. Sixth, it has a reporting requirement. Our roads have become very dangerous. As vaccines take hold and masks come off, there is one epidemic that seems to be digging in its heels, the epidemic of pedestrian deaths, bicyclist deaths, and driver deaths. We can and should take action. I hope you will issue a favorable report on the Safe Roads Act of 2022. And Madam Chair, just a quick postscript. There's an organization in Montgomery County that we don't see here often. They're all volunteers, but they've been extremely helpful to me on this issue and on this bill. They're called the Action Committee for Transit, and I want to thank them on camera for all they do back home in my community to keep all our road users safe. Thank you, Madam Chair.
Thank you. All right, I don't see any lights on, so you probably were very clear. All right, we'll go to your 2 witnesses, Jan and Franz.
Thank you, Madam Chair. Good afternoon, members of the committee. I'm here today, Jen Breck-Cancellieri, for the record, with High Street Strategies. We're here on behalf of Bike Maryland, and we thank Senator Wellstrecker for his leadership on this issue. I want to refer you to Josh Feldmark's testimony that you have in your written packet, and also want to comment there was significant testimony on the House side on this bill, and they just didn't have the folks didn't have the ability to be here in person today, so I definitely want to point out, especially the Anne Arundel Bike AAA, which is the Annapolis and Anne Arundel County Bike Advocacy Group, and WABA, the Washington Area Bicycling Association. I want to actually just take on one of the issues that's kind of obvious about this bill that might be a concern, which is the fiscal note. So the fiscal note for this bill, it ranges from $70 million up to $87 million a year. And I want to put that in context for the fact that our CTP that's in the budget, the Consolidated Transportation Plan, actually notes they're expecting to get $3.4 billion, that's with a B, dollars over the 5 years this bill calls for a ramp up. So this legislation is basically taking that 20% increase expected and saying, let's put 2% of it toward pedestrian and bicyclist safety, which is very important, as I know we all would agree. So I just want to put that fiscal note in context. And then also in context that we have been ignoring the repairs that have been needed on our roads for decades. And so what a bridge upgrade or making an intersection safer might have only been $500,000 20 years ago, it's several million now to fix. And so that is also reflected in the fiscal note, is the cost of the upgrades that are designated and reserved in this legislation to save lives. So we urge a favorable report on SB 588, it's been a long day, SB 880, thank you.
Okay, thank you, and we'll go to you, Franz.
Thank you, Chair Kelly, members of the committee, for the opportunity to address the bill. My name's Franz Schneiderman. I'm with Consumer Auto. We work for safety, fairness, and transparency for Maryland drivers and road users. And, you know, we strongly support the bill because it really is important to safety, chiefly for the most vulnerable road users, including pedestrians and cyclists. But frankly, the same kind of design changes that work to slow down traffic and protect those road users also, work to protect drivers. Even though drivers sometimes complain about those changes, ultimately they do benefit from the safety improvements. Now, as Senator Waldstreicher said, we really have seen a dramatic spike in fatalities on the road over the last couple of years. It was up 7% in 2020 and another 12% for early figures in 2021. And pedestrians died at record numbers in 2020, but the rate of pedestrian deaths has been growing pretty significantly for the last 15 years or so. It went up about 45% between 2010 and 2019, from about 4,200 a year to about 6,300. It was 6,700 in 2020. And we know these deaths are patterned. About twice as many people die in low-income neighborhoods as in middle-income census tracts, and older Americans and African-American residents are more likely to die as pedestrians than other Americans. So not only does it protect vulnerable road users, to make these design changes, it protects some of our most vulnerable systems. And then just quickly, increasingly, people who study these issues know the kind of design figures that makes roads dangerous and know how to address them. And frankly, in Europe and other advanced countries, the rate of pedestrian and vehicle deaths has come way down in the last 20 years, whereas it keeps creeping up here. And the difference isn't the technology or distractions on the road or people drinking and driving, because that happens, that's pretty much the same here as in other places. The difference is these road design issues. And this bill, it does cost some money, but it allocates some money to really do significant things about that. That would be important for safety on the road. So thank you, and I'm happy to listen to questions.
Thank you very much. Okay, that ends the testimony on that bill. And we're going next to Senator Kagan, Senate Bill 639, Consumer Protection, Security Questions and Measures.
Thank you, Madam Chair. I grabbed the wrong purple folder, so I just got my steps running back down to the second floor and back up again.
Okay.
For the record, Cheryl Kagan, very proud to be the senator for Gaithersburg and Rockville. I'm doing penance today to my good friends on Finance Committee. I have no witnesses that are in person, and I'm going to be very brief. That's after 911 yesterday. I figure we'll give you an easy day. Last year, you all passed, and the Senate passed unanimously, an important consumer protection and privacy bill to outlaw financial institutions, banks and credit unions and others, from asking for a mother's maiden name as the only security question, the one required security question. And the reason for that was because with that information, and you may remember that I read 11 maiden names out publicly, and Senator, you weren't here yet, but I'm sure we can dig that up in a hot second, which is really terrifying, because with that information, if that's the security item in your bank account, then someone can hack into your account. We all know how many hacks there are. Ransomware at the Department of Health, whether it's Facebook, LinkedIn, or whatever, we are all vulnerable, and we need to move away from this. So last year we said, financial institutions. This year is kind of 2.0, proposing to expand it, and just says, we shouldn't be having this as a required security question. And as we did with banks, we made it prospective. They don't have to go back and fix everything, but it would be reported to the Attorney General Office of Consumer Protection if a business tried using that. And we have a minor technical amendment because they don't have the capacity to supervise and correct local government entities. So they suggested, and we came up with an amendment that said, let's do it, just send a letter saying, yeah, really don't do this. And the impetus for this was when we had an EHE site visit to a Howard County public school. We were required to give the mother's maiden name to go to a public school. So we need to do a wake-up call. We need to make sure that this is not a default, because it is antiquated. 1882 was when this started, and 140 years later, with the internet, it takes a buck and a couple of minutes at max to get access to a mother's maiden name. Let's outlaw it and make sure that that is not making our constituents vulnerable. So with that, I'm happy to take questions, and that's it. There's written testimony in your folders.
Senator Vital.
Thank you. So what would you propose that people can remember? Because that's a problem.
Great question. So Comcast and, so many different, utilities and others, whether it's name your favorite pet, your first grade teacher, your college roommate. there are a million different questions that we've all seen that we can remember, or we can make stuff up.
Just so we remember what we made up.
But we remember what we make up, right?
Sometimes I have trouble with the favorite dog,
Right.
the favorite place to travel. It's like, which one did I put down?
Right. Yeah, those are more obscure because, I love Paris. But then again, Portland, Oregon is really beautiful too. Yeah.
Just
So
wondered
that's a
what
problem.
you're proposing. Thank you.
Yeah, good question. Thank you, Senator Vital.
Okay, seeing no more questions, that ends the testimony.
Thank you
on
all.
Senate
Take care.
Bill 639. Thank you. Okay.